Almighty God, who, in thy infinite wisdom and providential goodness, has appointed the offices of rulers and councils for the welfare of society and the just government of man, we beseech thee to behold with thy abundant favor as thy servant, whom thou hast been pleased to call to the performance of such important trusts in the Commonwealth of Dominica. Let thy blessing descend upon us here in this Parliament assembled, and grant that we may, as in thy presence, treat and consider all matters that shall come under our deliberation, in so just and faithful a manner as to promote thy honor and glory, and to advance the good of those whose interests thou hast committed to our charge. All which we ask in the name and for the sake of our Lord and Savior, Jesus Christ. Amen.
Suspension of standing orders.
Insofar as we meeting under the provisions attached to Standing Order 11.3, the House is hereby informed that all other standing orders related to the formality of these proceedings, such as sitting of members, are suspended.
Motion on amendment to the standing order. To the
Mr. Speaker, I first want to thank you and of course your dedicated clerk for the arrangements made for the sitting of this Parliament in light of the social distancing legislation and also legal health advice. But I believe that we maybe need to explore it further, and I therefore wish to move a motion for the consideration of the whole House. Mr. Speaker, if you so allow. Mr. Speaker, I move that the Honourable House directs the Honourable Attorney General to provide legal advice to the Honourable Speaker on the possibility of holding Parliament utilizing video conferencing.
Mr. Speaker.
It has been moved and seconded that this Honourable House directs the Attorney General to give advice to the Speaker of the House in regards to the possibility of using teleconferencing platform to ensure that we can hold the House of Assembly proceedings. Those in favor? Those against? The ayes have it.
Mr. Speaker, could we also put a time to it, maybe Attorney General by the end of the week? So by the, what's Friday's date? Because I'm not sure whether today is Sunday or Monday this year. So.
The 10th?
10th.
Yeah. So Friday 10th it is? Okay. Yes, so it has been further moved that we give, this Honourable House gives a deadline of Friday the 10th, April 2020. So I would still say, those in favor? Aye. Those against? The ayes have it. So it has been moved and seconded by this Honorable House that the Attorney General is directed by this Honorable House to give legal opinion to the Speaker of the House in regards to the use of telecommunication conferencing platform to ensure the proceedings of this House. And a deadline of Friday the 10th April be given as a time limit. So that's the decision of this Honorable House.
Adoption of the order paper.
Mr. Speaker, I move that the order paper be adopted as amended.
Second, Mr. Speaker.
Obituary and congratulatory remarks. Announcements by Speaker.
Under these special circumstances that this Honorable House has the honor to meet today, we have taken very careful attention to the issue and guidelines of social distancing, and therefore I just point out to this Honorable House, not that I will read it, because we have circulated a guideline that all members can have a copy of. And in the guideline, I'll just highlight something there so the general public can take a lead. All members of this Honorable House shall wear mask. All shall wear mask and ensure the protocols outlined are adhered to. We have set up this seating arrangement to ensure that we have a minimum of at least 6 feet from each other. I know it's going to be troublesome to use the mask and the lever, but it's for the protection of all of us here. For the general public information also, usually in normal process of this Honorable House, we have invited guests, or we call it in the standing order, strangers, which would include the general public, PSCs, technical officers, senior government officials. But for this special emergency meeting, what we have done is we have limited our invitation to the media as strangers. Only members of Parliament are here, and they are seated both downstairs and upstairs. That is to ensure the social distancing. So I would like to say that members of this Honorable House, as parliamentarians, as senators, we'd like to also encourage at the community level the example we have set here. We also have in the protocol or guideline where all members, if they are going in or out, they should sanitize their hands before leaving and after when they are returning. So all that is in keeping with some of the guidelines and protocols set up by PAO, WHO, and even our regional and national institutions in Dominica and in the Caribbean region. So I just wanted to just point that out specifically for our honorable members of this House to understand that we are taking this matter very seriously and we should be guided accordingly. We are not going to read the details of the guideline, but we just want to say that we have guidelines in place which are written, so we can proceed.
Presentation of papers.
Mr. Speaker, I beg to lay the following papers on the table. Proclamation declaring a state of emergency in Dominica, SRO number 14 of 2020, Emergency Powers Curfew Order 2020, SRO 15 of 2020, and 3, Proclamation reconvening Parliament, SRO number 16 of 2020.
Government notices.
Mr. Speaker, I beg to give notice that at a later stage of the proceedings, I will be taking all stages of the bill shortly entitled Emergency Powers Amendment Act 2020, standing in my name on the other paper.
Statement by ministers. Introduction of bills.
Mr. Speaker, I move that the bill shortly entitled Emergency Powers Amendment Act 2020 be read the first time.
Emergency Powers Amendment Act 2020.
The bill has been read the first time.
Public business, government business, motion.
Resolution. Mr. Speaker, resolution of Parliament to approve emergency disaster COVID-19. Whereas Section 7 of the Constitution and Schedule 1 of the Commonwealth of Dominica Constitution Order 1978 provides that the President may declare a period of public emergency if he is satisfied, inter alia, that a public emergency has arisen and as a result of the imminence of a state of war between Dominica and a foreign state, or as a result of the occurrence of any earthquake, hurricane, flood, fire, outbreak of pestilence, outbreak of infectious disease, or any other calamity, whether similar to the foregoing or not. And whereas under Section 3.1 of the Emergency Disaster Act 1503, it's provided that where Dominica or any part thereof is affected or likely to be affected by any disaster, the President may, by proclamation in the Gazette, declare that a state of emergency exists in Dominica or any portion thereof, and under Section 3.2, that no such proclamation shall be enforced for more than 1 month without the issue of another proclamation or as before the end of the period. And whereas it is further provided under Section 5.1 of the Act that where the proclamation of emergency has been made, and so long as the proclamation is in force, the President may make order securing the essentials of life of the community and for the preservation of the health, welfare, and safety of the public. And whereas it is further provided under Section 5.2 of the Act that orders made under Section 5 of the Act may, without prejudice to the power conferred by Section 5.1, provided for the various actions. And whereas it is further provided under Section 5.3 of the Act that the orders made under Section 5 shall be that the President was satisfied that the public emergency has arisen in Dominica as a result of the occurrence of COVID-19, an infectious disease commonly known as COVID-19, and declared a state of emergency. And whereas the President, under Section 5.1 of the Act, has issued an order, the Emergency Power Curfew Order 2020, statutory instrument number 15 of 2020, which was published in Official Gazette on the 1st of April 2020, and whereas Section 17.4a of the Constitution of the Commonwealth of Dominica provided the proclamation shall, unless previously revoked, remain in force for 21 days or for such longer period, not exceeding 6 months, as the House may determine by resolution supported by the votes of the majority of all members of the House. Whereas the Minister responsible for national security, seeks the approval of the House for the Proclamation Statutory Instrument number 14 of 2020, issued by the President on the first day of April 2020, to remain in force for a period of 3 months, and for the Emergency Powers Curfew Order 2020, SRO 15 of 2020, to continue in force for a further period of 21 days, and after the 20th day of April 2020, to reduce the spread of COVID-19. Be it resolved that Parliament approve the continuation of the Proclamation Statutory Instrument number 14 of 2020, SRO 14 of 2020, issued by the President on the 1st day of April, to remain in force for a period of 3 months, and for Emergency Powers Curfew Order 2020, SRO 15 of 2020, to continue in force for a further period of 21 days after the 20th day of April 2020, to reduce the spread of COVID-19.
Seconded, Mr. Speaker.
Mr. Speaker, don't laugh, please. Mr. Speaker, I stand before this honorable House to seek its approval for resolution for the Proclamation Statutory Instrument number 14 of 2020, SRO 14 of 2020, issued by the President on the 1st of April 2020, to remain in force for a period of 3 months, and for the Emergency Power Curfew Order 2020 to continue in force for a further period of 21 days after the 20th day of April 2020, to reduce the spread of COVID-19. Mr. Speaker, this resolution must be sought pursuant to Section 5.3 of Chapter 1503 of the 1990 revised laws of the Commonwealth of Dominica, and it must be done because without the resolution, Mr. Speaker, the proclamation would expire in 7 days from Monday, and the curfew on April the 20th, 2020. According to this section, order made under this section shall be laid before Parliament as soon as it may be, and after they are made, and shall not continue in force after the expiration of 7 days from the time when they were so laid, unless a resolution is passed by Parliament providing for the continuance thereof. Mr. Speaker, this resolution is hereby commended to the Honourable House.
The motion is before the House for debate.
Mr. Speaker, thank you. Very good morning to the honourable members of the Parliament, and a very good morning to the people of Dominica at home and abroad. I want to take the opportunity, Mr. Speaker, as we examine the resolution, to thank all the healthcare providers and other public officers and others on the front line of the fight against this COVID-19 pandemic. I want to thank the members of the government, the officers of the state, the public servants generally, the people of Dominica who have been doing their bit from their various stations to help us through the ravages of this pandemic. I want to say that the parliamentary opposition fully supports any measures at this time to contain the spread of COVID-19 in our community, so that the initiatives of social distancing are particularly important, and so we welcome the state of public emergency proclaimed by the President last week, and we also support the necessity of a curfew. The issue we have in the parliamentary opposition is with the correct application of law and the need and necessity for obedience to the rule of law, especially at this time. The resolution that we are talking about tells us that the Section 3.1 of the Emergency Powers Disaster Act, Chapter 1502, 1503 it should be, that's a typo, it is provided that where Dominica or any part thereof is affected or likely to be affected by any disaster, the President may, by proclamation in the Gazette, declare that a state of emergency exists in Dominica or any portion thereof under Section 3.2. And that no such proclamation shall be enforced for more than 1 month without the issue of another proclamation at or before the end of the period. So what we're doing here is necessary. But it states here, it's further provided, that under Section 5.1 of the Act, that where a proclamation of emergency has been made, and so long as the proclamation is in force, the President may make orders securing the essentials of life to the community and for the preservation of the health, welfare, and safety to the public. Mr. Speaker, the law, the Emergency Powers Disaster Act, Chapter 1503, gives no authority whatsoever to anybody to interfere with the movements of people as provided for in the curfew order. And I say that because the Emergency Powers Act at 5.2, tell us that orders made under this section may, without prejudice to the generality of the powers conferred by subsection 1, provide for the requisition of all forms of transport, the requisition and regulating the supply and distribution of food, clothing, water, fuel, light, and other necessities of life, and fixing maximum wholesale and retail prices in respect thereof. It provides for, at C, 2C, for the requisition of private lands, buildings, and premises. And at D, it provides for the conferring of, on any person, the right of entry or passage through or over any private lands, buildings, or premises. E provides for the demolition of any building or other structure deemed to be dangerous. F provides for the disposal of the dead and for dispensing with inquiries under the Coroner's Act and from the provisions of the Registration of Births and Deaths Act and the Cemetery Act. And G provides for the payment of adequate compensation within a reasonable time in respect of anything done under any orders made under this Act. So it goes on to outline the areas in which orders can be made. That's the law. 1503, under which we're seeking to establish the Emergency Powers Curfew Order 2020. While no provision is made for curfew under 1503, the Emergency Powers Disaster Act, there is clear provision in the Emergency Powers Act 1502, where it is provided at Section 2D that orders can be issued to prohibit any person from being out of doors between such hours as may be specified, except under the authority of a written permit granted by such authority or person as may be specified. So what the government is looking for in bringing this piece of legislation and this resolution to the House is to curfew people, restrict them to their homes. That restriction does not exist. That authority to restrict, to so restrict, does not exist in the legislation that they have cited. 1503. However, the legislation 1502, Emergency Powers Act, clearly provides for it. And therefore, all we are asking the government to do is to commit to the correct application of law and to have this emergency powers curfew order issued under the Emergency Powers Act, Chapter 1502. Because on the 28th of February, on the 28th of March, I learned sometime in the evening after 7 o'clock of the imposition of a curfew in Dominica, a 58-hour curfew, to start from 10 o'clock on the night of the 28th. Only to find out a few days later that the government was backtracking because they realized an error had been made. And then the president is issuing the proclamation of a state of public emergency in Dominica, and subsequent to that, orders for curfew have been issued. The process is right. But let's just be clear, let's just be sure that what we're doing is correct. And I'm saying, for the benefit of this House, Honorable House, and the people of Dominica, there is no authority for curfew orders by regulation under the Emergency Powers Disaster Act of 1990. I forget which year it was? Well, Chapter 1503. There's no such authority there. But there is clear authority under the Emergency Powers Act, Chapter 1502. I urge the government side to pay attention to this. We support the provision outside, in the context of this correction that we are proposing. Thank you, Mr. Speaker.
Anybody else can talk? Anybody else? You can talk? Mr. Speaker, I, of course, give support to this resolution. It is a resolution which is necessary, in my humble opinion, in the circumstances. And I'm glad to note that the Honourable Member for Marigot has given this House his assurance that himself, but also, not only himself, but also the other members on his side, who he, I think, expressed a view on behalf of, support the resolution and all measures that are deemed necessary to achieve the goal that I think all of us want, which is to try to ensure that we protect ourselves individually and collectively as a nation against this disease, this dreaded disease that is afflicting the whole world at this time. It's unfortunate that he couldn't give his unqualified support to it, but he expressed, as he's entitled to do, reservations, particularly, as I understand it, in relation to the legal processes and what he has expressed as being the incorrect legal process adopted in relation to the proclamation, and more particularly, that's a proclamation issued by His Excellency the President on the 1st of April, SRO 14 of 2020, but more particularly the curfew order issued thereunder, SRO 15 of 2020. Mr. Speaker, the fact is that the honourable member is incorrect. It's perhaps understandable that he's incorrect, but the fact is that he's incorrect in relation to what he submits on the law. He may have been, I don't know what version that he was looking at. He referred to Chapter 1502 of the Emergency Powers Act, and he expressed the view, as I understand it, that in his opinion, the proclamation, and more particularly the curfew order, should have been made under the Emergency Powers Act, Chapter 1502, as opposed to the Emergency Powers Disaster Act, Chapter 1503. Mr. Speaker, Chapter 1502, in the correct version, and that's the version that contains the amendment that was made to that act in 1996, by way of Act 2 of 1996, provides wording which does not provide for the proclamation that we would have been seeking in the circumstances that we were seeking it. The correct version of Chapter 1502, and it may be, as I say, it may be that the honourable member was looking at a version that appears, if it has not been updated in some of the laws, if it has not been updated to incorporate Act 2 of 1996. I don't know whether that's the case, but I am prepared to extend that interpretation on his behalf. Because the amendment provides, if it appears to the President that a public emergency has arisen as a result of the imminence of a state of war between Dominica and a foreign state, or that any action has been taken or is immediately threatened by any person or body of persons of such a nature and on so extensive a scale as to be likely to endanger the public safety or to deprive the community or any substantial portion thereof of any supplies or services essential to life, the President may, by proclamation, declare that a state of emergency exists in the state or any portion thereof, whereupon the provisions of this act shall immediately come into force. Mr. Speaker, anybody who either reads Act 2 of 1996 or heard the words that I just read will notice that whilst it speaks of a public emergency, and that having to be as a result of the imminence of a state of war between Dominica and a foreign state, or that any action has been taken or is immediately threatened, notice, not by a virus, but by a person or a body of persons. This does not give the authority that the honourable member believes it does. Therefore, the only act that the President could operate under, in accordance with the advice and in terms of the legality that the honourable member refers to, is Chapter 1503. The reason for that, Mr. Speaker, is that Chapter 1503, the Emergency Powers Disaster Act, provides under Section 2 of that Act, where it defines disaster, it provides in that definition for epidemic. And it is by way of that provision that the proclamation effectively could be proceeded on. The disaster is defined there for the purposes of completing the exercise in transparency. Disaster means any grave abnormality such as hurricane, tornado, storm, flood, high water, wind-driven water, tidal wave, earthquake, volcanic eruption, landslide, drought, fire, explosion, epidemic, pollution, transportation accident, oil spill, or any other catastrophe that warrants mobilization and use of extraordinary human and economic resources to repair damages caused or to circumvent those that could arise during the situation, or to generally confront and overcome such a severe and unusual situation. So, Mr. Speaker, in what I just read out as the definition of disaster under that Act, it's only epidemic that we could bring ourselves under. And indeed, that is one of the reasons or a further reason for the fact that the House will today be asked to pass an amendment to the Emergency Powers Act, Chapter 1502, because it is perceived that as currently worded, that act is somewhat limiting in terms of the various circumstances of emergency that could arise, and therefore it's necessary for us to provide a tool to enable the state properly to deal with all issues. Because in fact, there is, even by bringing it under epidemic, you could be open to all sorts of arguments. But indeed, one is clear, and I think most reasonable-minded people would feel that the situation that we're now in is within the bounds of an epidemic situation in respect to this, and would understand and accept that we have to proceed to protect ourselves individually and personally, and indeed collectively. I could say more, Mr. Speaker, but I think just for the purposes of this exercise, and in terms of supporting the resolution, I wholeheartedly endorse the resolution, and I hope that the explanation I've just given is of some assistance to all. Thank you very much.
Okay. Pleasant good morning to everyone. Mr. Speaker, I rise to make my contribution in this Parliament sitting here as regards to the resolution being put forward here today. I must confess we've never been faced with such a situation before, which brings special activities and special events in such a special time that none of us here are familiar with. But it is important to acknowledge the fact that the fight against COVID-19 has to be a united fight. There must be a collective approach. There must be a collective approach, because we as individuals cannot be safe unless everyone is safe. And the international community recognizes this. If we don't deal with the virus here, it means the rest of the world is at risk because of us. If the rest of the world doesn't deal with the virus, it means we are at risk because of the rest of the world. So the approach has to be one where everyone is involved. It's a collective approach, internationally, nationally, and even within our own local communities. We have to acknowledge that fact. We have to appreciate that fact before we can even think of how we're going to handle this pandemic that we're facing, COVID-19. Having said this, Mr. Speaker, Dominica is doing everything possible it can do at the moment. Considering our resources, our manpower, etc., we are putting everything that we have right behind our defense and our preparedness as regards to COVID-19. Our approach, and that is the approach that the international community and all the experts have agreed on, it's based on case identification and social distancing. So our case identification activities have been extensive. We've been going all out there. As a matter of fact, if you were to see the reports, most probably Dominica has done the most cases in most of the Caribbean islands. But that also is because we have the capacity to do those cases. That's because we have the PCR machine, and that's because we have the tests and the reagents that we can do it. Now, with all of this case identification, so far, we have identified 3 index cases. Index case 1 gave us 9 contacts. So index case 1 and the 9 contacts would be 10 cases. Index case 2, we tested all the contacts. They were all negative. Index case 3, we got 2 of the contacts positive, and 1 of the contacts of that contact, which is the first second generation contact, positive. So that means we have a 10 plus 1, that's 11, plus the third one, that's 12. 2 contacts of number 3, that's 14, and 1 second generation, so that's 15 cases. So that is where we stand at now. But we can only say that because we have done extensive amount of testing, that is our case identification program, which we know is working, and the international community is commending us for that, considering we have done many more cases than so many of the Caribbean islands. But for us to pull this off, we have to appreciate the fact that we have frontline workers out there doing all of this hard work. Whether it's the doctors, whether it's the nurses, whether it's the ward aides, whether it's the domestic workers, whether it's the lab, whether it's the radiology department, whether it's the pharmacy department, all our frontline workers are out there. Our orderlies, every single one is playing their part. Our drivers, every single one is playing their part, so we can get to these contacts, swab these contacts, get the test done, and know exactly where we stand. So this is all about our case identification and our contact tracing, which has been excellent so far. As a matter of fact, we could actually trace that someone in St. Lucia who was on a flight, we could actually trace it to our third index case. So it just tells you how extensive our contact tracing goes. And we actually found the people who were sitting next to this person on the flight, and we had to do all their contact tracing as well. So basically, we're leaving no stone unturned, Mr. Speaker. We're attacking this aggressively, and we're contact tracing every single place. Apart from this part, we have to appreciate the fact that we get assistance from our friendly governments. So we must be very thankful when we get such assistance from the People's Republic of China. As a matter of fact, we got 15 test kits, PCR test kits from the People's Republic of China. We also got 30,000 masks. We have 50 non-contact infrared thermometers. We got 20,000 gloves. And the list goes on and on and on as to all the assistance we're getting. PAHO also has given us tremendous assistance as regards to more than 3,000 reagents for testing of PCR. And we also got 14 boxes of PPE, that's the personal protective equipment. All this is helping us to fight. And also, the icing on the cake also, we got 35 health professionals from the Republic of Cuba. So Mr. Speaker, these are the friends in need, and they've really come good in a very speedy manner. And for this, we're very grateful and we appreciate those things. So let alone our own contact tracing, let alone our case identification, we also have friendly governments that are also helping us in terms of our human resource and in terms of our supplies. But you have to put this into perspective, because internationally a lot of these supplies are in they're scarce. And when our friends can come, and even to the extent that the People's Republic of China are going to give us 15 ventilators, Mr. Speaker, these things mean a lot to us, and these things help us in our preparedness and our defense as regards to COVID-19. An integral part of our defense is also quarantine. And at the moment, we started off with almost 8 quarantine facilities. Now we are down to 4 quarantine facilities. And these 4 quarantine facilities, Avisville has 44, Kenneth Byron Apartment 13, Claudette Wallace Apartment 8, and the Portsmouth Beach Hotel 44, which gives us a total of 109 people in quarantine. At this quarantine, we have the family nurse practitioner, 1 SNM, 5 community health aides, we have 2 public health graduates, and all of these people are the ones handling the quarantine. Services are up to date, and everyone is pleased with the service that we're doing. Initially, there were some little teething difficulties. These were eventually settled out, and I must say all our people in quarantine are pretty much comfortable. Free Wi-Fi, internet, everything, their meals on time, and we're taking care of them as we're supposed to do. As a matter of fact, today we might be discharging quite a few who've completed their 14 days. Tomorrow as well, and Wednesday as well, quite a few of them would have completed their 14 days. But it is important to note that quarantine is an essential part of the fight against COVID-19. And people in quarantine, whether it's at the facility or whether it's at their home, they should see that as their contribution to fighting COVID-19. That is the part they're playing. So when the history books are written, they can say, yes, I obeyed my quarantine, I played my part. So it's not just a matter of just restricting people's movement and people's freedom. It's a matter of restricting the virus, and that is their contribution in the fight against COVID-19. Now, the social distancing has to be enforced and it has to remain. It has shown to be effective. And we are begging the public that, yes, they should adhere to all the measures being put forth by the Ministry of Health. It's been proven internationally. Let us not be on the wrong side of history. Let us just adhere to the measures of social distancing. These have worked, and they will work if we just stick to it and we practice it as diligently as we ought to. But all of these measures, Mr. Speaker, whether it's the contact tracing, whether it's the quarantine, whether it's the social distancing, all of that, life has changed forever after COVID-19, and we have to appreciate that fact. And in terms of our resilience and in terms of sustainability, we have to take it as an education exercise. We have to learn from this exercise. So all the different measures we're putting in place and all the different activities that we're putting in place, this is the education process going on, and that is what's going to make our effort here sustainable and resilient in terms of our health approach in Dominica. So the education part, this is why the Health Promotion Unit has been so involved in educating us and sending out the messages of what we're going to do to prevent this virus from ravaging our country. So let us remember all the good things that are going on now as regards to hygiene, etc., must continue even after COVID. And that is how we can say that, yes, this was a sustainable effort and a sustainable event that took place in Dominica. If we go a little further, Mr. Speaker, as I mentioned earlier, I explained our different cases, our 15 cases, but all of these that we're saying here, we have to give thanks. And there are so many people who have come to the forefront and assisted the government in all of this. And then I must make mention of a few of them. That is the Springfield Trading Limited, HHB Research and Company Limited, Dominica Brewery and Beverages Limited, Cots Dominica Limited, Fort Young Hotel, Secret Bay, Tranquility Beach Resort, Robinson's Bakery, Benjo Simos, and LA Enterprises. These have come with, whether it's in terms of just food supplies, providing meals for our staff, etc., but it means a lot to us, and we're eternally grateful for them for providing such things. So, Mr. Speaker, having said all of this, we want our case identification to continue. We want our contact tracing to continue. We want the people to obey and adhere to the measures of whether it's home quarantine or quarantine in facilities. We want the people to be forthcoming with information when we have people coming into our communities that could have come in through illegal means. Please let the healthcare workers, because this is where the danger can be. We need to be able to monitor these people coming into our shores so that we can contact trace them, we can quarantine them, etc., and protect everyone here in our country. So I have absolutely no reservations in supporting this resolution, Mr. Speaker. I think it will go a long way in our preparedness, and I think we should all support it and be very proud that we can bring forward such a resolution with the hope and intention of keeping every single one of us here safe in Dominica. I thank you.
Mr. Speaker, parliamentary colleagues, just take a good look at everyone in this chamber. Coronavirus has changed the world forever and even changed the way we conduct parliament today. This is a time for deep reflection, personally and collectively, before a solution is found for COVID-19. Some of us in this honorable house may not make it. We therefore have the responsibility to break all barriers, prejudices, petty partisanship to save our nation. This cannot be business as usual. We need to listen to each other. We need to embrace contending views to save our nation. A different view does not mean an attack on anyone. It will ultimately bring out the best for our nation, and it will bring out the best in us. While Parliament must enact laws which may be deemed draconian at first sight, we must accept the need to keep our citizens safe, and this must be foremost in terms of our responsibility. However, if these laws are not accompanied by compassion, love, equality, and fair play, if these laws come without a consideration for a survival package, not a stimulus package, our most vulnerable citizens will die, and our most vulnerable businesses will disappear forever. When I think of our senior citizens, persons with pre-existing conditions, diabetics, cancer patients, hypertension, dialysis patients, asthmatics, tuberculosis patients, persons with disability, how do we target immediate assistance to these vulnerable groups? This is priority. This is compassion. This is the right thing to do, Mr. Speaker. There needs to be a survival package for farmers who will supply us with fresh, healthy foods in the coming months. Imports will be affected, so we must be self-sufficient. We must plan for the long haul. Our fishermen need to be empowered to increase their catch. Indigenous hotels, restaurants, tourist vendors, market vendors, taxi and bus operators, they too need a survival package. Our health workers, doctors, nurses, lab technicians, wardens, policemen, firemen, sanitary engineers, customs, stevedores, port workers, everyone on the front line of this war on COVID-19 need a survival package. And on that note, hats off to those of you who put your life on the line to save the rest of us. Grotto Home, fax, calls, DAPD, all homes for seniors need a survival package. In all other OECS and Caribbean countries, the Parliament is rolling out their stimulus package, but I call it our survival package in order to highlight the resulting fatalities, both of human and businesses, if we do not do the right thing. I thank you very much.
Mr. Speaker, I rise to give a very short intervention in the resolution and the motion before this Honorable House. But I first want to, again, express my sincere gratitude to the many planners, the people who are involved in preparing our nation to fight this invisible enemy. But also very importantly to Mr. Speaker, the people who volunteered in large measure to be on the front line of this fight on behalf of the people of the Commonwealth of Dominica. And Mr. Speaker, I make reference to the domestic workers, people who have to go in to sanitize the isolation units, to remove the waste, and to ensure that the facilities remain sanitized at all times to minimize the exposure of our medical and health practitioners. I want to thank the nurses and the doctors, many young doctors, and I don't want to call names because so many of them have come forward to volunteer. Those who are inside the COVID center, as we call it in Portsmouth, and the isolation unit, people who have distance themselves from their families for an extended period of time. You know, our country, Mr. Speaker, should be proud of our citizens for this. Proud of our citizens for this effort. Because we see in many parts of the world where people are not afraid to come forward to assist the nation in treating patients who have contracted this dreaded virus. And their fears are well placed, and we do not look down on anybody who has a fear and who has anxiety. This is normal human behavior. But we are grateful for those in Dominica who have come forward. I also want to place on public record our gratitude to a gentleman called Double O in Portsmouth. Mr. Hamilton and his crew, his sisters, and all the people who assisted in preparing the facilities in Portsmouth. And just on the weekend, Double O had to go in to the center to block a couple holes that the doctors and nurses were complaining about, risking himself to go in there as a contractor to assist with this facility. And I think these are the people whom we should be highlighting as heroes of our country. The policemen initially had some reservation, and rightly so, but once they were exposed to information on this matter, they understood, and they now fully engaged, being marshaled by the chief, and in particular the deputy chief of police, Mr. Speaker. The firemen, the fire chief and the deputy, we can never have enough words or the appropriate words to commend them for their heroic effort. And the orderlies, so many people who are engaged. You know, we have people like Mrs. Jennifer Astapan, who's come forward to assist us. People like Dr. Fuhrer, who has been at the providing services to our citizens for many decades. And even at his age, I know you want to play young on some speaker, but he has come forward. He lives in Mount Daniel. When I called him, within 15 minutes, he was at my office to provide the services towards our nation. Dr. Esprit, Dr. Blanc, Dr. Ahmed, who is from Bangladesh, not a born Dominican citizen. Mrs. Jemat, the lab superintendent, and all of the lab technicians who are assisting us in doing the testing and the swabbing, the district nurses, the district medical officers in the various districts, the nurses, Mr. Speaker, at all levels, the principal nursing officer, Nurse Ravalier, for her exceptional leadership, the permanent secretary in the Ministry of Health, the matron, Mrs. Loblack. All of these people have been assisting the nation. And I want to say thanks to all of them on behalf of the people of Dominica, Mr. Speaker. But Mr. Speaker, when we stand, whether here or outside of this precincts of the Parliament, to say that we support the measures of the government, we must not say so with a different tone or a different rhetoric. We must be consistent if we are sincere about this. Because if we say this must be a national effort, it must be a national effort. It must be a national effort. Mr. Speaker, from my own personal ideological standing, I am against the taking of people's right to free movement. I am dead against this from a fundamental ideological standpoint. But this is not an ideological battle, Mr. Speaker. This is about a battle to save lives and to save the lives of our citizens of Dominica. And we are prepared as a government to take all of the measures to protect every single life in this country. And those who call on life, on death, I rebuke the calling of death on anybody, Mr. Speaker. None of us shall die in this country by the grace of God from this virus. That's what we should pray for, not to call on doom and gloom and death on a people or a nation. That's not what it is. The Bible did not teach us that. And neither do we get this counseling in Sunday school. We must always speak life on people, longevity on people, good health on people, Mr. Speaker. And that's what we shall continue to pray for. We'll do everything humanly possible to protect our citizens. And that which we can't do for ourselves and by ourselves, we shall look to the Most High, Mr. Speaker. And that's what we're doing. And we are happy and unfortunate, Mr. Speaker, that we have the facilities to test in Dominica, because testing is critical. This must be driven by data. That's what the experts say. Yes, it has to be a combination of quarantine, staying indoors, social distancing, but also critically testing. And so far we have done over 277 tests, because we have the lab and the facilities and the trained personnel to do so. Do we have a perfect system to fight this COVID virus? The answer is no. But which country has? None. None. And we empathize with every single country in this world and every single nation in this world. States who are combating this virus with varying degrees of success. And when you look at the deaths all over the world, Mr. Speaker, it brings a chill to our butts. And so we sympathize with the nations that have had deaths so far and the citizens of the world, because this has to be a battle of unity against this virus, Mr. Speaker. And while on my feet, I want to extend to the Prime Minister of the United Kingdom a speedy recovery, and to the Prince of the United Kingdom, and all those who've been impacted by this virus, that there will be a speedy recovery. I follow the leadership of the Governor of New York and the great challenge which our friends in New York is having. And we can only watch and pray for them and hope that they will overcome this humongous challenge of fighting this virus. And here in Dominica, we have our own fight with our own limited resources. And I say to the people of Dominica that we will spare no effort of providing the resources required, as expensive and demanding as it is, to ensure we can treat and save lives in our country. And that is our commitment. There are some who will come and talk about stimulus package. That is fine, that is great. But that is not our preoccupation now. Our preoccupation now, our preoccupation now is about fighting this virus. Because what, as one economist says, what benefit is economic stimulus if none of us are alive to benefit from it? And we're not saying that we're not doing things behind the scenes, Mr. Speaker. I have had meetings with the IMF, I have had meetings with the World Bank, we've had meetings at the Monetary Council in order to mobilize resources, speaking with the European Union, and to see whether we can redirect existing resources to assist persons who will be directly impacted financially and economically by this disease. Just on Friday we met at the Monetary Council, and we reduced the discount rate from 6.5% to 2%. Making more liquidity, more money available to the banks in the Monetary Council, so that in the hope that they can lend to the private sector at cheaper interest rates, Mr. Speaker. These are the actions we're taking. And when people talk about caring for people in this country, nobody can surpass the compassion of this Dominica Labour Party. And we are committed to ensuring that all those who will be in need of a helping hand This government is committed and ready to assist every single citizen who will need a helping hand to ensure the survival of their businesses and to ensure that they can have food on the table to provide for themselves and for their families. And I want to commend the representation given by the member for La Plaine, my friend, Honorable Ken, who through his own efforts have been able to mobilize food packages to needy families in Dalis, and who himself has gone in there to ensure that the cooking gas, which is much needed in these communities, are made available by mobilizing transportation to transport the empties and to take back the full bottles to the village of Dalis so that the people of Dalis can have access to this facility. And I'm saying to our country and our citizens, we must not treat the community of Dalis as a pariah in our nation. This is a virus that could any one of us could get infected. And we should not be viewing this community as less than anywhere else in Dominica. And so the idea of wholesalers and retailers and cooking gas people do not want to go into Dalis to deliver supplies, that is not necessary. We can go in there and deliver food supplies to the people. This is our citizens. And I'm hoping that we can put an end to this. So, Mr. Speaker, this motion here before the House is something to enhance the safety of the people of Dominica. That's what it is about. For us to come and to be sifting in the sand at Belleville Beach, trying to see whether there's an error into this and that. That is not necessary. What we should be doing here is to stand on the desk and the tables and tell the people of Dominica to follow the guidelines of the Ministry of Health. Follow it. There should not be any ifs or buts. There should not be any ifs or buts. That is what we're talking about when we talk about unity. Unity in fighting this. So it's not time for us to sound bright or to sound like intellectuals. This is the time for us to work together to fight this, Mr. Speaker. Understand my anxiety where this is concerned. Because I know what the frontline people are going through on a daily basis. I'm in touch with them. Come here and sifting things and looking at wrong documents and inadequate documents. Mr. Speaker, I fully support this measure. And let me say to the citizens of Dominica, when we tell you stay inside, stay inside. We send you home from work. Hey, you're working from home, you're not working from the streets. Work from home. And if it means that we'll have a complete shutdown of gas stations, of supermarkets and banks and everything else, we will shut down this country to protect the lives of the citizens of Dominica. If you're not respecting social distancing outside of Dominica and outside of the supermarkets, outside the credit union, we will go to a complete shutdown, Mr. Speaker, because we are saying to you that we have to pay attention to the guidelines and the advice of the Ministry of Health. It's a battle we're fighting. This is worse than a hurricane, Mr. Speaker. Hurricane will come into massive homes and we'll go out next morning to assess the damage. This is a moving target. The whole world is fighting at the same time. Understand this. And you cannot look to anybody for help now because everybody now looking for help. Everybody's looking for help. And that is what we must do. So when we go on social media, we go on a radio program, we must be positive and positive vibes. Repeating what the Ministry of Health is saying to the citizens of Dominica. Because failure to act in a responsible manner, will be to our own detriment as a country. And if we say we love this country, and if we say we love the citizens of the country, when they are to stay home, we should say to them, stay home. And if it doesn't Parliament, Mr. Speaker, I would use a little word, Mr. Speaker, but I'll use it outside of Parliament. And we have to stay home. We have to stay home. And we have to look out for, we can't rely only on the government to look out for everybody. If you have senior citizens next to you, members of Rose or not, go and look for them. Go and look for them. That's what we're saying. If anybody needs help, let us reach out to them. That's what we should be doing. But do not come here, my brother, my colleague, parliamentary colleague, and try to let us all be marching in the same line. Marching in the same line. So the issue of economic stimulus package and so on, this thing will be dealt with at the appropriate time. But now, we are fighting to survive. We are fighting to stay alive. We are fighting to stay healthy so we can live to see another day on this land that the good Lord has given to us, Mr. Speaker. And that is our preoccupation in the government's life. So those who want to have a long dissertation about stimulus package and all of these things, and some bright and some pretty and some fancy, that is fine. But when Hurricane Maria hit, we kept on thousands of people on the wage, providing wages to them. We have a record of this. But now is for us to do what is required and what is advised to fight this virus, Mr. Speaker. And I'm saying, I'm having this impassioned plea to our citizens. Please, it is better your life cut than your life cut. So, when you go out there and you see Dominica lying outside full up, I say, my brother, boy, I'm going home. I'm going home. And come back when you see the line is reasonable or in keeping with the social distancing policy enunciated by the Ministry of Health. Each of us has a responsibility to our safety. And each of us has a duty to protect each other. And if we have that simple understanding, life would be much better and less difficult for all of us. Because the 14, 15 cases that we have thus far, we would like to contain this. I would like to get the report from the Ministry of Health to say that the 14, 15 people have gone home. They have been tested and the virus is no longer there. Their immune system has been boosted and they can go home and be with their families. And so that our frontline workers, after they have gone through the quarantine period and testing, can go to their children, go to their families, and reunite with their families, Mr. Speaker. That's our prayer, our simple prayer. We're not asking a lot for money and riches. I don't pray to you a lot for money, Madam Speaker, for this nation, as much as we need it. I pray to this God to save our planet and to save the citizens of this country from this virus. So, those who want to play politics in this, fine with me. Fine with me. But I have no time to play politics in this thing. I have no time to play politics with the life and safety of our citizens. And so this measure here, Mr. Speaker, this measure here is to try to save lives and to contain the spread of the virus. And look at all of us here, how muzzled we look before a mask, Mr. Speaker. We thought this was only for pit bulls and look at us here. You know, Shakespeare really said, all the world's a stage. You know, but it is necessary. You understand? And to wash our hands. Now, we all carry that's so black because dozens of these things, you know, and we spray ourselves. If I go in, I have to spray myself and so forth in the house. We all have to do what we have to do and what we must do, Mr. Speaker. And I want to commend the leadership of the Minister for Health in this effort, Mr. Speaker. You know, and the nation is fortunate and grateful to have somebody with the capacity and the abilities and the maturity of Dr. McIntyre for his efforts. And to my colleagues in cabinet, in Parliament, in cabinet, who are all working diligently in the various committees and the permanent secretaries and the CAPSEC and the financial secretary and all of the public officers, Mr. Speaker, who are part of the planning of this effort. Everybody's playing their part. But I want us to, as a nation, to minimize the fear and anxiety of the people. Let us help each other manage our fears and anxiety. And if we do so, that will be a major plus for us. And I also, before I sit, I also want to thank Dr. John Colley McIntyre for his efforts as the logistics coordinator. He was largely responsible for commandeering all of the actions needed to get this operation, this COVID center set up and established in Portsmouth, and I will thank him for this. And people like Floyd Capitola, and also Ian, member for Portsmouth, Honorable Douglas, this youngster who drives the bus, who drives the staff to and from the center, Rohan, works double shift, you know, from day one. And he has the intrinsic motivation. You know, I believe that sometimes in these times, it really shows the capacity of our citizens and the abilities of our citizens. And so I want to express my gratitude to them. And of course, to say thanks to the revolutionary government of the Republic of Cuba. They too have the fight. They too have to confront an increasing hostile embargo against them, Mr. Speaker. But they're always willing and ready to reach out to citizens, to countries across the world. And within 48 hours of a letter dispatched to the President of the Republic of Cuba from myself, I got a favorable response from them, providing 35 health and medical professionals to assist us in fighting this. 25 nurses, 6 doctors, and 4 lab technicians. And I understand the People's Republic of China, another ally of the Dominica government and the people of Dominica, notwithstanding all of what they have gone through, all of what they have gone through and still going through, Mr. Speaker, they have been able to reach out to us, and the minister indicated to us the extent of the medical supplies and equipment that they're providing to us. You know, ventilators, Mr. Speaker, is more valuable than gold now. You understand? And for us to be able to secure additional 15 ventilators in this period, I think we have to say thanks to the People's Republic of China for this. And the other nations that have reached out to us, you know, people call me, Mr. Speaker, friends of his government, friends of his country. I tell them, no, we're right. We are with you in prayer. At the end of this, we can talk about other things. But we are with you in solidarity. So my letters to them is not to ask them for anything, but to extend solidarity to these nations. And to continue to pray for themselves, for the government of these countries and the citizens of this country. Because I understand where it is. Will there be serious economic and financial dislocation? Of course there will be. In the OECS alone, Mr. Speaker, it is projected that there will be a financing gap between $1.4 billion and $2.3 billion. Every single country in the world is looking for money to mobilize resources, first to fight this virus, and what is left to do other things with it. Understand this. But let us not distract deliberately the nation from what is at hand currently. And what is at hand currently is a fight against COVID-19 in Dominica and the entire world. And we remain resolute in our fight. This is an uninvited enemy in this country. It is a war that we're fighting, and you just can't see it. And the reality is, That there be many of us who might be walking the streets with it and we don't know. We don't know. And this is why these measures are necessary. But if they are not respected and obeyed in the manner in which they have been articulated, then we'll have a challenge. So my sincere appeal to our citizens is just obey the thing, my brother. You ask for no work, we gave you no work, work from home, then work from home. You can go in the backyard and plant your peas with the social distancing in effect. But let us do what we must to protect ourselves from this deadly, deadly virus. And I thank God that we have had no deaths so far, and I pray to God that we shall have none at the end of this battle. Thank you, Mr. Speaker.
Mr. Speaker, one thing that is clear here is that the Honorable Prime Minister and the Minister for Health and the entire team of this side are not daunted by this deadly virus, COVID-19. Mr. Speaker, I'm happy that...
Speaker, just an observation. We have members of the Parliament sitting upstairs who cannot, in the normal course of things, interact with the microphone as they would normally do to get your attention. And I think some of them up there would like to contribute, so yes? Before, you're closing the debate, right?
I'm sorry, my apologies.
Yeah.
Yes, yes. I agree with the opposition leader. Please take your seat and let us see.
Senator John Finn is on the way down.
Okay. So in regards to Senator John Lewis, we'd ask a member on the opposition side to vacate the seat. Okay. Thank you, Honorable Danny Lugie. So just for public information, we have asked that the Honorable Danny Lugie vacate his seat to maintain the distancing protocol so the Senator John Finn can deliver.
Thank you, Mr. Speaker. Again, good morning, everyone. I rise, Mr. Speaker, to make my contribution to this proclamation. Let me ask, Mr. Speaker, why are we here? We are here because we realize all ideas do not remain in one head. The opposition members have ideas as well. And whatever we have to say is not an attack on what the government is doing. We are not attacking. We are simply trying to supplement. Because we believe we know what they're doing, what is happening is, well, let me say, I am in full support of this regulation, of this proclamation. Complete support, 100%. This mask, yeah? I'm in full support of this proclamation, and anything to do with the safety, the lives of the people of Dominica, I will support it. So I'm saying again, whatever I say here in my presentation is not an attack on anyone. It's not an attack on any idea or suggestion of anyone. It is in support to add a little more strength, a little more meat to whatever is being done in this crisis. Let me compliment the Ministry of Health on what they're doing, and all those on the front line. Their lives are at risk, and they're doing it for all of us. So we are not attacking. Mr. Speaker, we're in a crisis right now. And every effort, all hands must come on deck. So I want to say that we are in unity with whatever is happening to save lives in Dominica. The parliamentary opposition is in unity with what is happening. So do not, Mr. Speaker, do not believe that what we say is not in support. Again, I'm saying it just to strengthen what is happening. Mr. Speaker, life will not be the same. Life is not the same under COVID-19. Cannot be the same as usual. This pandemic, it presents massive challenges to the health and welfare of the people of the world. The Caribbean, Dominica is no exception. But, Mr. Speaker, we must obey the curfew, and we will encourage people to obey the curfew. But it's one thing to obey the curfew, but it's another thing when you have hungry stomachs crying to you and you have nothing to give to them. Why? You have lost your job, you cannot sell anything, you have to close down your business, and many other reasons we can think of. But, Mr. Speaker, with this pandemic, Dominica is different from the other Caribbean islands. Because I follow the news and I know that there are other islands in the Caribbean, or sister islands, who have put measures in place for their people. But we have not heard anything. We do not know. I heard the Prime Minister say that measures are being put in place, but we cannot say it is being put in place if we do not know. Mr. Speaker, but our farmers, or teachers, or students, or elderly, everybody will be inside because we ask people and we want people to stay home. Because that is the way we can contain this virus. That is the way we can reduce the spread of this virus. Because we have 14, 15 cases. I pray God that this number does not increase. Mr. Speaker, many persons, when they wake in the mornings, they have no jobs to go to. Well, yes, our farmers will go to their farms, but after a while, frustration will creep in because they cannot sell anything. Nothing can sell. Or small businesses will be forced to close down. They have closed. Our bus drivers, our taxi drivers, their buses have packed. Because I can speak specifically for my constituency. Many buses transported persons to Roseau to work. You understand? Mr. Speaker, others transported persons to Roseau to do the little business, but now they have to pack because institutions are closed, offices are closed. Mr. Speaker, with this pandemic, Mr. Speaker, you have your chance to speak. Let me speak. Mr. Speaker, Saint-Sauveur is a fishing community, or fishermen, they too are part of it. You know where I'm going. That is why you are trying to disturb me. But I will continue, I will speak. I call on the government. I heard my Prime Minister said that something will be put in place later down. That these are just suggestions I am giving. I am just giving some suggestions to support what is to come. I call on the government when the time comes to prepare whatever support that they have to give to our people, that they put measures in place so that the fishermen, that fishing community, the people depend solely on fishing for their lives. Put something in place, put measures in place so that the government can purchase the excess fish. And maybe even a hotline where they can call if they find themselves in distress. Mr. Speaker, our elderly citizens, well, this has been spoken about, so I will not go in there. But what I will say is, the subvention, the old age pension, how it is called, the subvention that our elderly people are given, I suggest that it is raised to $500. Now, our students, Mr. Speaker, our students are at home. While other students in other districts are following classes online, the students in the remote areas of Dominica cannot do that. They do not have that luxury. I call it luxury because it has not been, the villages of Saint-Sauveur, Good Hope, Petit Soufrière have not had internet service since Maria. And so, teachers are asked to conduct classes online. How are these teachers in these areas going to conduct classes online? My suggestion, maybe the government can sign an agreement with one of the providers, telecommunication providers, set up some spots, some Wi-Fi spots, powerful enough, so the students from these areas can access the internet and do their work online. Because parents cannot buy data. They cannot afford to buy data. Maybe if somebody buys $20 or $30 and you put that for a week, well, that's it. That's it. That is my suggestion. Mr. Speaker, the people are urgently waiting to hear from the government in this regard. Because fear of the unknown, they don't know what is happening unless you tell them. Fear of the unknown is what will more adversely affect our people. Mr. Speaker, we do not need vague promises right now. We do not, because you can't motivate people with vague promises and illusions. You will motivate them with the truth, the bold truth of where they are now, and the inspiring truth of how they can be better tomorrow than they are today. Mr. Speaker, the government is not here because of popularity. The government is here because the work that they are called to do is very important. And that is taking care of the needs of the people. So, Mr. Speaker, I endorse all the recommendations. The parliamentary opposition, through the opposition leader, submitted a document, and there are many recommendations in there. And these recommendations are worthy of implementation for the benefit of our people. I wish to recommend that this honorable House seriously and urgently considers the contents therein. Mr. Speaker, let me also encourage the government to follow in the footsteps of the other sister Caribbean islands and prepare something for our people. They need to know how this government is going to cushion the effect that this COVID-19 is going to have and is already having on our people. We need to know. They need to know. Mr. Speaker, we must urgently, we have to do it urgently, because as I said, fear of the unknown will cause people to indulge in other activities. Yes, we want them to stay inside. Respect the curfew. But we have people who may be struggling, Mr. Speaker. Single mothers with children who are locked in. What are they going to do? Stay inside. But how are you going to survive? Government should tell them, because they need to know, and when they know, maybe they'll feel a little better. Tell them what you're going to do for them to cushion that effect. So, Mr. Speaker, again, I support this proclamation. I support it fully, the curfew and the state of emergency, because as I said, I do not want these numbers to rise. Okay? I want our people to remain inside, practice social distancing, wash your hands, and do everything that it takes to ensure that our people are safe. But, Mr. Speaker, I also look forward, I support, but I look forward with great anticipation to the package, the stimulus package, yes, the stimulus package that will cushion the effect of this virus on our people. I thank you, Mr. Speaker.
Mr. Speaker, did I stand first?
A member is standing up upstairs, so Senator Masler is coming downstairs to deliver.
Good day, Mr. Speaker, Cabinet colleagues, parliamentary colleagues. My apologies for that, Mr. Blackmore, if you felt anyway. Dreams do come true, sir. Honorable Prime Minister and the leader of the opposition, I just want to really weigh in on the discussion, and considering the global situation with number of cases in excess of 1 million, deaths in excess of 70,000. Dominica is doing well thus far, considering that the cases are limited to 15. And I support the resolution and the motions brought forward to this honorable House, as I view the implementation of these legal limitations as a manifestation of the good intentions of the government and the efforts towards the protection of lives of its people and those in the region, and may I further submit to contribute towards the global fight against COVID-19. However, moving forward, we need to, now that we have gained some degree of control over the containment as ably presented by the Minister of Health, who I want to publicly applaud for his efforts thus far. And there now presents this opportunity that we move into further mitigation or limiting of further spread of the virus within our communities. What we have seen is certain pockets of the infection developing, and what we don't want to see is new ones emerging while we are still busy fighting what exists. And this window, if we miss this window and allow autochthonous transmission to continue, then the battle is going to be much harder. We have called for approaches which manage and integrates and synchronizes the various facets of our national response, Mr. Speaker, and with this aim of advancing the efforts to keep the infection curve as low as possible. Ideally, I would like to appeal to all Dominicans under the sound of our voice at this honorable house that we place emphasis and be cognizant that our health is our responsibility. And I urge each and every Dominican to follow the advice, which in all fairness has been simplistic, but most important, it hinges on common sense. And I want to further applaud the Health Promotion Unit of the Ministry of Health and the relevant staff for doing a good job thus far. The frontline workers within the primary healthcare system has been doing a commendable job. And for me, serving as an environmental health officer within the Ministry of Health, I noticed, and that is always one of the challenges when we applauding people, we tend to miss out some staff, and the Honorable Prime Minister missed out the environmental health officers who, under the international health regulations, conduct port health activities, are the frontline members of this fight against COVID-19. I want to acknowledge the works of Kershaw Augustine and Claire Ann Carbon, who are stationed at the Douglas Charles Airport and who have been, from inception, doing a tremendous work. And he ably, Mr. Speaker, outlined various sectors, various departments of the Ministry of Health. Out of the abundance of caution, I know we have been doing well in testing and getting negative results, which are welcome. Out of the abundance of caution, because too good to be true will always be too good to be true. And I just humbly suggest that we verify our test kits, verify our systems, review as we go along to ensure that we remain ahead of the situation. If we are to successfully contain the spread, we need to also see greater synergies between public health experts and private sector healthcare providers. They could also assist us in conducting the surveillance testing for those members of our society who are able to pay for such, and they could also reduce the burdens on our labs and our clinics. I also believe that we could successfully assist, they could successfully assist scarce resources in a timely manner. And we saw those who are not, we saw public sector enterprises private sector enterprises who have assisted in some way or the other. And I also want to publicly weigh in and commend them for whatever is done in this time of need. It means a lot to our overall fight. As we are aware that the situation is fluid, I want to reemphasize that we put all our measures at staying ahead of the situation. Mr. Speaker, this COVID-19 situation is something that is quite nascent for us, and one of the provisions I would like to see being brought forward is really making it mandatory for people, especially the essential workers, and people who have to commute, because we are not under a total lockdown, that they at least wear personal protective equipment. This would also assist tremendously in reducing the possibility of the spread. Mr. Speaker, as a country, arguably, we have done our level best in the containment of the spread of coronavirus. And not only should we quickly bring on board mitigation strategies, but we must also look at ways that we could cushion the possible impact on our country. We may win one war and become vulnerable to the subsequent war. Mr. Speaker, please, let's consider the case of a pump attendant or a service provider at a supermarket who lacks health insurance, who may be symptomatic, diabetic, or those who have unique concerns are people with hypertension, HIV, lupus, or even those recovering from cancer treatment. And they are asked to stay home. And bearing in mind that they may or may not have sufficient savings or disposable income. Now, it is a given that we need to minimize social activity, which means, in simple, that we have to save lives while life has to go on. Now we are pressed to find ways as a country to implement measures that will limit the easy movement and interaction of Dominicans. But we do not want to place measures that will then force perfectly law-abiding citizens to disregard the law and venture out only to find themselves being infected and then further contribute to the spread of this virus. Despite our obvious challenges, it is not too early to start putting ourselves in that position to, one, cushion the impact on vulnerable persons and, to a lesser extent, businesses, and to explore the opportunities within the pandemic where we can secure our country and limit the crisis. Mr. Speaker, I heard my colleague from Senator Ernie John Finn, who spoke about the plight of the bus drivers. As long as we remain in partial lockdown phase, they will continue to be an essential service. Sometimes even some of our public servants aren't able to afford a private motor vehicle and have to depend on public transportation. It is of great concern because we are now putting legislation in place that will, one, limit the hours of operation that would then impact on the total amount that could be of revenue that they make. And we are also limiting the number of people that could be placed. And I'm humbly saying that because from a public health perspective, we have to be sometimes pedantic to be able to ensure that we remain ahead. It may look trivial for some of us, but I'm sure those with some public health experience, I'm sure you're claiming on my time, sir. You claim, Mr. Speaker, can I get some protection, please? Yeah. So, we don't want, we are, yes, putting restrictions on the bus drivers to maintain social distancing and to maintain and to limit the spread. We also, don't worry, you'll laugh later. The government should also consider making it easier for these essential people within our country by allowing them at least some voucher at the pump. Because bearing in mind that the greatest contribution to fuel costs are government taxes, we can do that. I'm sure you can do that. I'm sure that the other side, I know you all are much better than that. You can sit and discuss and have a discussion as to how we explore this possibility so that we don't force bus drivers to overload their vehicle and then to further contribute to the spread. Also, Mr. Speaker, don't worry. Also, Mr. Speaker, we want to also take into I am happy that the legislation brought forward mentioned the restriction of visitation to the state prison, and this is very, very well welcomed, and I want to commend them on doing that. But that also opens up a concern as to the
Member, I would refer you to Standing Order 46. You can anticipate a bill where really only the substantive matter here is the proclamation dealing with the curfew. So you cannot anticipate the next bill coming forward.
Thank you, Mr. Speaker.
All right.
So, it must be borne in mind that Dominicans from all different walks of life, those with numerical age, which find themselves into this risk area or this vulnerability group, or those with physiological age, some of them exposed to different stressors within their own environment, will be exposed or possibly exposed to this imminent threat. COVID-19 has highlighted the inextricable links that exist between us, regardless of our political differences, regardless of our religion, class, or race. If we are not in this fight together, our best bet is that we all would be sick together. Hence, it is in your interest. It is in your interest. It is in your interest that we on the opposition side remain healthy. Likewise, it's our interest that you remain healthy. And as such, Mr. Speaker, I want to again commend the government at its efforts. I want to commend the government at its efforts. Nothing is foolproof, but we all stand united in this fight against COVID-19. I thank you, Mr. Speaker. May God bless Dominica, and His perfect will be done, even through this crisis.
Honorable Blackmore.
Mr. Speaker.
Honorable Blackmore, we have one more member upstairs coming.
Good morning to all, and Mr. Speaker. Thank God that everybody here is alive. We have a lot to give God thanks for, because when we get up every day and we look at what is happening all around us, we realize we should be grateful to be alive. I am especially grateful because somebody very close to me was affected by it. So imagine every morning a phone call comes and you're not sure what you're hearing. So forever thankful. The person has recovered, thank God. So I, as with everybody else here, I am in full support. Even anything to make it mandatory. Mr. Speaker, I thought this was a debate, yes? It is? Yes. So we look at the issues. Thank you, Mr. Speaker. Now, this is a debate. I heard earlier on the bill is up for debate, and this is what we're doing. We are not going to criticize, we are not here to menace anybody, we are not here to make noise, we're here to assist, and this is what we want to, because we want everybody to be alive and well. Now, I saw what happened at Dominica this morning, and this is really serious business. And we have to take measures to ensure that these things do not happen. I saw in Antigua that they are giving masks all over the island, and they're going to make wearing of masks mandatory, and no problem in that. If people do not hear, then you have to mandate. Any measure to mandate, we agree. But as was said earlier, we are in a war. And when you are in a war, you have to fight the battle at all fronts. So we have to fight it health-wise. We also have to fight it economic-wise. So hence the reason for asking for help or assistance to ensure that our people's health is in good order and their nutrition is in good order. They can eat well and fight the virus. So this is what we're talking about. Not just sitting here and agreeing that everything is okay. Yes, we do agree that we need all those measures, but with these measures have to come counterbalance with something else to cushion the blow that we already heard about. This, Mr. Speaker, is what we are asking for. A package, something to give to our people to make them happy to be inside. This is what we are saying. So we are hearing from the other countries exactly what is happening. If we pay attention to our sister islands, we'll see some things that they do that we can pattern on. And Mr. Speaker, this is what we are asking for, that we pattern on these islands. I want to say thank you to all our frontline workers, everybody, from those who pick up our garbage at home to everybody else who put their lives on the line. Now, if they're putting their lives on the line, we want to make them very happy. So if they know their family is taken care of, they don't have to worry of their sick grandmother or their vulnerable person that they have at home, then I'm sure that they are doing well, but they'll do even better when we ensure that they themselves are taken care of economically, they eat well, and they can ensure that our people are safe. So we are asking for this as well, Mr. Speaker. Now I want to say thank you to, we have a team, a group in Dalis called Jadelis. Some of them in the States, they were affected by the virus, but they've raised in the excess of $5,000. And we are grateful for that because they give food. We also augmented what was done in Portsmouth at the quarantine centers. So I'm happy that our people, in spite of everything, they are coming together to assure that their fellow men are taken care of, Mr. Speaker. So we are saying that, as you've heard with the others, we took a look at our education, access to them. Could you tell us exactly what is happening in recommon entrance? These are things that we have to tell people, and people have to know. Because in the absence of information, people speculate. And this is what we do not want, for people to speculate as to what should happen or what is going to happen. So we need that information. So yes, I agree. The health of the nation is important, and we have the health professionals who are doing a very good job taking care of that aspect. But as the other side of it, which is the finance part of it, the economic side of it, we need that in collaboration or in conjunction with this in order to take care of our people. Now, I want to condemn some of the things that I said about the people of Dalis, because I know that people, as soon as they tell, in fact, I was attacked because they thought, well, I lived up there. And they said, you know, since you're from Dalis, we do not want to have anything much to do with you. So this is a crisis already that is happening. You know, we're targeting some people. So we have to take measures to ensure that this does not happen. What about the mental health of our people? I heard about, taking care of testing, which is very good, and all the measures, and all the persons who have come to our assistance, giving us the material and equipment. We thank them very much. But we also have to talk about the mental health of our people. I was saying they are, because at the end of COVID, life continues. And we do not want to have another problem after COVID. Our mental health people must be in order. And as you know, we have a lot of people who went into hard drugs and alcohol. And they will go through the withdrawal symptoms as well. And I was listening to the news in the UK where domestic abuse has increased by 30%. So we have to look at what is happening around us to ensure that it does not happen to us here. So we talk about domestic violence, we talk about child abuse, and all these things we have to pay special attention to in collaboration with taking care of our people's health and wellness. Because at the end of the day, we do not want people to eat the wrong food and to get obese, and then, bam, you had another health problem on your hand when COVID-19 is finished. So this is what we are asking for, a proper measures in place that include all parties in it to ensure that we have a good message going out, everybody spreading the message. And as you've heard from the opposition, we have been saying that all along. Stay home, wash your hands, take care of your family. We have been advocating that for a long while. Okay, so we are not in discordance with what is going on. We are in total agreement with measures taken to ensure that our people are safe, to ensure that at the end of the day, we have healthy people who can continue to develop this country. So, Mr. Speaker, we're not here to fight and scream and to shout at each other and to make you think that your contribution is not important. Every contribution is important. Every contribution. And when we have a debate, we expect to have opposing sides. And this is exactly what we need to do to ensure that all ideas contend. You're at your home and everybody else has another idea, but you have to look at it in essence. You will not take everything, but there are some things that will work for our country. So this is what we're asking, is do not let everybody else, and we ask for inclusion. This is what inclusion is. It's not to prevent or muzzle people from saying what it is that they have to say. So Mr. Speaker, as all of us said, we are in agreement with the measures taken, but to counterbalance that measure, in order for people to stay home, you have to stay home. You have to wash your hands. You have to do certain things. You cannot be by Dominica and by doors going that long kissing each other. You have to ensure that this takes place, but we have to put measures in place to ensure that this happens. We know our people, some things we have to enforce. We come and we enforce it, and we don't have a problem as long as it works well to ensure that the safety of our people is paramount. So, Mr. Speaker, as I said, I am in support, and I say thank you to all those who have their lives on the line. While we sit at home, we are sleeping, people are out there putting their lives on the line. Today, I heard about the virtual parliament. It would have been lovely if it had happened today. It would be nice to be home to do it, but I'm sure it will come to pass. So I say thank you very much, and I hope that Dominica stays safe, that we take all the measures that the opposition is projecting to you all, and look at it. Don't just discard it and say, oh, with this and with that. We are in favor because we are Dominicans too, and everybody else is our family. We are people on the front line. So, Mr. Speaker, what we're asking to is total support for our people on the front line to ensure that their head is in good order when they go to help us at the health centers and the clinics, that they know that the people at home are being taken care of. And this is what we're asking. Give us the package, what is going to happen, when it's going to happen, what amount of money that you have allocated to help, because we have to balance it. And as everybody agrees, we are in a war, and if you have a war, you have to balance at all fronts. Your soldiers have to get food, and your soldiers have to be taken up. They have a doctor on call somewhere in the battlefield. So this is what we're asking for. Take care of our people in all measures, and I'm sure that the virus, at the end of the day, is eliminated. Thank you, Mr. Speaker.
My eyes fell on Honorable Alfred, Octavia Alfred, but I'm not sure where you want to speak. My eyes fell on you first. So do you? Okay. All right.
Good day to everyone. And Mr. Speaker, I rise to make my contribution to the bill that's set before the House and to pledge my support. We all know that we are facing some difficult times. These past few days have been rather challenging for many of us. And as visionary leaders, we know that there are tougher days ahead. And Mr. Speaker, first of all, I want to say thank you to all the healthcare professionals, all the essential workers who have placed their lives on the line in this fight against the COVID virus. I also want to say thank you to the Cuban delegation who came down to Dominica to give their support to our nurses and our doctors. I want to say thank you, and also to the Chinese nationals who contributed equipment to Dominica. Thank you very much. Mr. Speaker, presently, we are all called to duty to unite. And it really hurts my heart when we are speaking about unity, and at the same time we are trying to fight with each other and score political points. I don't think this is right at all. Every one of us should reach across party lines to fight against this virus. And I have started, even at the beginning, at our first meeting, after the COVID virus started across the globe, without it even being here in Dominica, I extended my hands to the parliamentary representative of the Salibia constituency, to the Kalinago chief, and everybody else who would have been able to work together to ensure that our people continue to remain safe. And so I encourage every one of you here today to put aside politics, and for once, let's do what is best for the country. Mr. Speaker, the Kalinago territory, as you know, is largely a farming community where more than 90% of our persons they practice subsistence farming. And so with this bill that's set before the House, many of them will be prevented from going out as freely as they would have used to. I'm asking that some consideration be given that passes be made to these farmers so that they can have access to their farms, given that they are provided with, well, they have the necessary gears to go out and continue their farming. Also, I have spoken to a few farmers in my community, and some of them are complaining that they do have foods that will stay and spoil. And it would be very good if the government can, and we can, put together a mechanism in place where these farmers would be able to get their produce to the supermarkets in Roseau or across Dominica on the shelves so that people would be able to buy it. This will increase domestic consumption and also add to stimulating the economy locally so that people would be able to still have some money in their pockets. And of course, I think it will also assist the government in when they're putting together the stimulus package to reduce the amount that they would have been able to give to farmers if these measures are put in place. In as much as I support this bill, I have a little concern, and I'm concerned about our frontline workers. I would like to know from the Minister of Health what measures are put in place to do continuous testing of our frontline workers, because they too are at risk. And the nursing homes, since they are they're filled with elderly people, what level of support are we giving to them to ensure that our elderly in this nursing home continue to remain safe? Mr. Speaker, also, presently the Kalinago territory and the Salibia constituency by extension has free healthcare facilities, and one which is a main facility that is used widely across the constituency. We're asking, in the event that the the condition, the healthcare system becomes overwhelmed and there's a need for more COVID centers, that one of these facilities be assigned
The member
take
just,
care of our
the member, just for clarification, you said that you'd like the Minister of Health to repeat the question, so I might give him 1 minute to respond before we wind up the debate.
to consider assigning one of these facilities as a COVID center so that our people who are diagnosed can be nursed within that facility and have close contact with relation to their people.
Okay.
Because being in Portsmouth is rather difficult to travel there to maybe drop food or so. Mr. Speaker, also, I have a concern in terms of our prisoners. Seeing that this pandemic is going to last for a while and we're extending the curfew hours, there are persons who are going to breach the law, and although we are really asking that they adhere to it and to stay home, but in the event that there are persons who break the law and they may have to be reprimanded, what's going to happen? We would like to know what's going to happen if there's an outbreak at the prison. What kind of measures are put in place to ensure that if there's an outbreak, what happens to the prisoners, especially our Kalinago prisoners who are also being housed at the state prison. We are laughing, but yet we're saying we are all equal. Every one of us are affected by the COVID virus. Whether you're a prisoner or not, you are a member of the state, and the state has a responsibility for you. And so, in consideration, we should also consider these people, because they too are human beings, and they are as important as those of us who are sitting on these chairs. I also, Mr. Speaker, would close in saying that I want the general public, particularly the people of the Salibia constituency and the Kalinago territory, to adhere to the protocols. I'm very, very grateful for many of them who have been staying homes. We know initially that many of the small shops selling alcohol had groups of people even after the curfew was stated, but now that has been reduced and the people have been doing very well. I want to tell them thank you, to continue to listen to the government and the healthcare professionals, and listen only to them, because I was rather surprised that a politician was passing on the road, telling people to stay in their house and giving advice. It would be very good if we leave the duties of the healthcare professionals for themselves, so that, because they have the information, they're better able to answer the questions. So let the healthcare professionals do what they are trained to do, and let us politicians do what we are trained to do. So with this in saying, some of us did political science. Some of us did political science. Some of us did political science, so we know. And we have to be smart. So, Mr. Speaker, thank you very much for this opportunity to speak on behalf of the Kalinago people and the people of the Salibia constituency. Thank you.
Mr. Speaker, good morning. I didn't think I would get there, but I think I have a responsibility to speak on behalf of the Ministry of Education. I want to commend, first of all, the leader of this government. I want to commend my cabinet colleagues. I want to commend the frontline workers. I want to commend all Dominicans for the effort that we are putting to ensuring that our people remain safe. I also want to commend the people of I don't know why they keep calling my constituents their constituents. Mr. Speaker, Mida is the parrot for the Cassibrus constituency. Octavia Alfred. So I want to commend the constituents of the Cassibrus constituency for obeying the protocols and the guidelines that are in place to ensure that they keep safe. And I want to also commend the Cassibruce Health team for doing an excellent work in those times. Mr. Speaker, looks like the opposition keeps fast forwarding matters. I thought that our basic reason for being here this morning was to deal with an issue, something on the table to ensure the safety of our people and to ensure that our people stay alive. But since they are pushing me and they are fast forwarding, I want this morning to speak on behalf of the Ministry of Education. It means that some people are not paying attention to the news. It means that some people are not paying attention to what is going on. Because if people are paying attention, they will know that the Ministry of Education has been ready for that since February. And therefore, I want to commend my officers in the Ministry of Education. I want to commend all the education officers, the principals, and the teachers for the efforts that you are making in this fight against COVID-19. Mr. Speaker, as a matter of fact, this week I had to send out a notice to ask our parents and teachers and our parents and students to give our teachers a break online because they're keeping our teachers real busy. I want to commend the Cassibruce Secondary School for holding their staff meeting via Zoom on Friday. So while some people are coming crying about you, you are making it work. And Mr. Speaker, since in February, the Ministry of Education conducted a survey. So we know exactly how many children in Dominica do not have access to internet. We know exactly how many children in Dominica do not have devices. We know those who have devices and they do not have internet. We have the information because we are not sleeping on us. This is not a thing that we woke up to in March, you know. This is a thing we've been preparing for since January. So we are well ready. And Mr. Speaker, I want to say to our parents, let not your heart be troubled. All right now, teachers are supposed to be, children and teachers are supposed to be on Easter break. And the provisions that we are making will include if we have to open late. We have already accessed memory sticks, hundreds of memory sticks, for the students who have devices but they do not have internet so that we can download relevant information for them. In addition to that, we are in the process of accessing devices for students who have service but they do not have devices. And we want to thank UNICEF for their support in this venture. Mr. Speaker, online learning is not about this virus. Online learning was there long ago. Last year, our students did CXC First Paper 1 online. So our students are well acquainted with Notemaster and the Learning Hub. We are ready and we are in a conversation with Digicel. So I ask, in the meantime that the opposition is trying to support in a non-supportive way, that they do not fast forward us because the Ministry of Education and this government, we know what we are doing. So today, I want to say that we are well ready. I want to thank the people of Cassibruce. I want to thank the teachers who prepared learning packs. We have learning packs prepared for students who do not have internet and devices. So they will also to have what we call a school in a bag. So our children, even if they don't have internet or devices, they will have a school in a bag. Mr. Speaker, what you can want again now, you have a school in a bag. And I say to the Senator John Finn, who used to be an educator, that my arms are wide open. If you want to help, come on board. But standing on the side and behaving as if you got it covered, sister, it doesn't help in the situation. So therefore, I thank all the people of the Ministry of Education. I thank our teachers, I thank our principal, and I thank the government of Dominica for the effort and the support you have given as we prepare to continue to educate our students in light of COVID-19. Thank you.
Mr. Speaker, I rise to give a short contribution to the debate. Although, Mr. Speaker, I'm not in the habit, and protocol would dictate, that we on this side of the House do not speak after our leader, Mr. Speaker. And I think that our Honorable Prime Minister and leader of the House and our party has been doing a tremendous job in the management of this crisis so far. Mr. Speaker, let us not forget that it was this Prime Minister who called early o'clock, I believe we were still in January, when a COVID-19 consultation was called among all relevant parties, Mr. Speaker, to assess the situation of where we are, what had to be done, what had to be put in place, Mr. Speaker, in the management of the impending crisis, as it were, at the time, Mr. Speaker. And Mr. Speaker, before I even go further, let me say how, not only on my own personal behalf, but I'm sure every citizen of this country, Mr. Speaker, is right now applauding the absolutely superb job that is being done at the Ministry of Health's level, Mr. Speaker. One of our finest medical professionals leading the charge in the person of Dr. McIntyre, Mr. Speaker, and he's doing an excellent job leading the troops. And I say so, Mr. Speaker, because I speak almost from a vantage point of ground zero, Mr. Speaker. And when I say ground zero, not only are the quarantine facilities for the country housed and situated in Portsmouth, Mr. Speaker, but the COVID center, in addition to the Chinese Friendship Hospital, which is based in Roseau, the COVID center, Mr. Speaker, is based in my constituency, in the Picard area. And as the Prime Minister has already said, that the persons who are managing this facility, from the doctors, go all the way down, Mr. Speaker, to the orderly and the other assistants, the ward aides. These people are doing a remarkable job in the caring of the patients that are there, Mr. Speaker. And we have been in this situation before. Look at where we were when we had to face Tropical Storm Erica, Mr. Speaker. And the quality of leadership we had, again, in the person of the Prime Minister, and at the time, our then Minister of Health, who was the parliamentary representative for the constituency that was had his seat. We came out with flying colors, Mr. Speaker. We went on again, another disaster, albeit a natural disaster, tropical storm, Hurricane Maria, Mr. Speaker. In fact, Hurricane Maria brought us to this very house for a like circumstance. We came to the house on a Saturday, Mr. Speaker. If you all can remember, those of you all who were there, we were here already. And we are again creating history, because I don't think that this Honorable House, and I am perhaps one of the longest serving members in this House, apart from Honorable Austrian Deputy Prime Minister and the Honorable Prime Minister, I don't think that this Honorable House has ever met within Holy Week, Mr. Speaker. And we are, in fact, in Holy Week. So, if you look at the historical trajectory of the management of the COVID-19 in Dominica, the government has done everything possible, Mr. Speaker, and is in fact doing and continues to do everything possible to ensure that we are on top of the situation as far as COVID-19 is concerned. And I've listened to the members of the opposition, and I'm wondering, where were they and where are they? Have they just arrived in Dominica? Do they live on Mars? Are they not here on the ground? And I mean, it's absolutely astonishing listening to the members of the opposition. And you see, it's very dangerous, Mr. Speaker, for you to believe and to put in your mind that every time you come to this house, every time you stand, you have to oppose. What is there in the measures before this honorable House that should generate opposition? And Prime Minister, you are wise, Prime Minister. You are wise beyond your years, Prime Minister. You are wise to the point where I am very amazed, because even before we got to the House, Mr. Speaker, we anticipated, what was happening here, Mr. Speaker. Every opportunity that the leader of the opposition and the members of the opposition are given to rise to the occasion as statesmen, Mr. Speaker, they continue to play crass political partisanship in a situation that doesn't warrant it at all. This is a situation where all of us should come to the House as leaders of the country and lead the nation in the fight and in defense of this COVID-19 crisis that we are in at present, Mr. Speaker. But we are seeing the members of the opposition are busying themselves with stimulus package and what you're going to do for the farmers and what you're going to do for the fishermen. Mr. Speaker, we have patients who have been struck with the COVID-19 as we speak, Mr. Speaker. We have healthcare workers on the front line of this fight, Mr. Speaker. Mr. Speaker, an entire facility was converted into a healthcare facility in a matter of days, Mr. Speaker, as was told to us by the Honorable Prime Minister. And while I am on that, Mr. Speaker, as parliamentary representative for the Portsmouth constituency, I want to personally thank all of the soldiers on the front line from Portsmouth. And the Honorable Prime Minister spoke about the captain of the team, who is Julian Hamilton, otherwise known as 00 Contractor. And 00 came on board with his team, Mr. Speaker, asking no questions about contract, asking no questions about money. All he said was, what is it that my government and my country needs me to do? And these guys worked night and day, Mr. Speaker, up to 3 and 4 o'clock in the morning, Mr. Speaker. And the Honorable Prime Minister again mentioned like people like his sister, the women who came on board to clean the facility, to get it ready so that the medical staff could roll into that facility at a moment's notice. And I have been there with them on the front line, even just yesterday, because again, the government is preparing a second and additional facility right now, and the guys are engaged as we speak. This is a government, Mr. Speaker, with vision. And you see, when we told the nation that leadership is everything, it is showing today in clear and unequivocal terms, Mr. Speaker, that leadership is everything. When I went to visit the guys yesterday to give them some motivation, the contractors and the guys, Mr. Speaker, there were persons in medical garb outside sanitizing certain things that were needed in the facility. And not only from the warded and the orderly, there was a doctor dressed in her medical garbs, and because of her face mask, I didn't even know she was a doctor. You cannot even differentiate who is warded and orderly from who are the doctors at that medical facility. Everybody giving their 100% support to the effort, Mr. Speaker. And Mr. Speaker, the preparation of the meals, the transportation of the meals to the quarantine facilities, the security at the facilities, the cleaners, everybody have brought, Mr. Speaker, 100% commitment to the table. So, we really hear, and it is really difficult, Mr. Speaker, to sit and have to listen to the members of the opposition, because they are just not in tune with what is happening on the ground. They are not involved with what is happening, Mr. Speaker. And I saw on social media one of my colleagues, the parliamentary representative for the Lapland constituency, so much involved in and showing so much care and concern for his people, involved in the packaging of care packages to go out to the vulnerable, the needy, and the less fortunate. And I say without any fear of contradiction that I am sure that every single member on the government side, Mr. Speaker, is involved at the constituency level, not only in the care and management of the COVID situation, but, Mr. Speaker, in the care and management of all of their constituents. So, Mr. Speaker, we are clear in our minds. We are confident and we are comfortable, Mr. Speaker, because of the leadership that we have in our country at this point in time, Mr. Speaker. We are happy that we have not only the leadership, like I said, at the government level, but at every single level, everybody is contributing to ensure that we have a success. And I know, Mr. Speaker, and I feel very confident in faith that our numbers will not increase. But if peradventure they do, I feel that we have done all within our power to ensure that we can manage and we can contain this pandemic, and so that we will continue to keep our country, the Commonwealth of Dominica, safe and secure until this pandemic is over, Mr. Speaker. Once again, I give my full
Honorable Blackmore, before we wind up, I know a question was asked to the Minister of Health. If he thinks that he wants to comment on it, I'll give him a minute.
Yes, Mr. Speaker, regarding the psychosocial support, as a matter of fact, 2 Fridays ago, we expected a recommendation from our head of our department. That didn't come through. It hasn't been sent to us as yet. So we decided we're going to be proactive in that regard. And as a matter of fact, this morning at 11, we're going to have our clinical psychologist on the radio giving a presentation. And that has been looked into, and we have a plan, and we have other programs that are going to continue as regards to psychosocial support for our staff and the COVID patients as well, and even those in quarantine. So that has been very well handled, and we shall continue that program, Mr. Speaker. A question was brought again about drug abuse. If the people listen to our press briefing on Friday, that was exactly what I was dealing with. Telling that it's not only diabetes and hypertension and cancer and renal failure patients, but those who are vulnerable as well are our people who use and abuse drugs, and I addressed this very well on Friday just gone. And the advice was given to them, and we are looking into this, and we are taking care of those people as well. So that is not an issue that has been well thought of, and we have plans in place for those things. Regarding our staff, our frontline staff were exposed. As a matter of fact, Mr. Speaker, we have tested 19 of our frontline staff who are involved. So it's not like we have our frontline staff out there and we're not taking care of them. Yes, we are also taking care of them and we are testing them, not only just in terms of providing meals and all of the things and their transportation and their accommodation, all of that, but we're also testing them. That is how we're going one step further and being proactive in taking care of our frontline staff. And we've done 19 of those. Regards our nursing home, yes, we've been dealing with our nursing homes. As a matter of fact, we had our training of COVID-19 to all our nursing homes regarding the signs and symptoms. We also gave care, we discussed the care of the elderly at all these nursing homes, which our health promotion team have been to. We also explained the measures of prevention to all these nursing homes. Our health promotion did that at all the nursing homes as well. And we had training for the Council of the Aging, and we also had training for the Yes We Care people. So as for nursing homes and the elderly, yes, that was taken into consideration, and these activities did take place at all these nursing homes, and even the Council for the Aging, and even the Yes We Care program. As regards to a COVID facility in the Salibia constituency, this is a fluid situation, Mr. Speaker. You don't just rush and set up a COVID facility in the Salibia constituency. I don't want to be naive. I'm not saying that we cannot have a surge of cases in a particular constituency, but at the moment, it is not necessary at the moment. Let alone that, I might just have every other constituency asking me for a COVID facility. If our resources, that's not feasible. So we do things in a stepwise manner, and at the moment, we are having our COVID facility in Portsmouth, which we're actually expanding to get more beds. Mr. Speaker, take note. What happened to Italy was they spread out their COVID patients to all the institutions over Italy. And that was the biggest mistake Italy made. We're not going to do that. We will not make that mistake. We will focus our patients in Portsmouth. We will deal with them in that COVID facility. If need be later that we have to, then we will. But at the moment, it is not necessary, and we shall not go the way that Italy went, Mr. Speaker. So in a nutshell, I think that addresses all the concerns from the other side, and I'm most willing to address any others.
Thank you, Mr. Speaker. I rise to wind up this discussion on this very important measure, and I want to commend all the speakers who spoke on this very important measure. Mr. Speaker, COVID-19 is a very serious thing, and it must be taken seriously. And it's not a question of trying to gain votes. It's a question of trying to save lives, Mr. Speaker. And that is precisely what the Prime Minister, the Minister of Health, and the Labour Party administration is trying to do. We don't want to put politics in this thing. But the opposition must be serious about its role in this thing. Mr. Speaker, you cannot propose to a lady to get married. And when you get to the altar, and the priest or the pastor asks of you, do you take this lady as a wife, or do you take that man as a husband? You have to answer, I do. It cannot be I do, but. Can you understand that? So it's either you support this measure before this house, or you don't. Mr. Speaker, we wanted to come in this parliament and in a very nice way and bipartisan way to move forward. Senator Sanford is a former nurse. She gave a lecture about a COVID center. But she had a mask upside down. So if you do not know how to place a mask on your face, how can you advise the populace to wear the mask? You have to be serious about this thing, Mr. Speaker. So, Mr. Speaker, I think that the Prime Minister has set the thesis for this discussion as to how they will respond to COVID-19. One, we are in a war, and the whole country ought to be in this war. It cannot be blue or red. There cannot be two Dominica. There has to be one Dominica. And if we fight this war as one, we will survive COVID-19 faster and more effectively, Mr. Speaker. Secondly, he said, and I want to give more currency to it, and I think all of us should give currency to it, we must first protect lives and think about things after. Because to benefit from any stimulus package, you must be alive. You cannot be dead. I'm sorry, Mr. Speaker. This is not a normal sitting. Mr. Speaker, the leader of the opposition made reference to the freedom of movement of people. But when you read section 12 of the Constitution, you must also read subsection 3A, which says that if an authority, by way of a law, exists for the express purpose of protecting public health, public order, or the defense of the state, it doesn't matter. Because an exception has been made in the same section under the Constitution. So you cannot read what you want and leave out the other relevant parts of this very important measure, Mr. Speaker. Mr. Speaker, this is a very serious thing. And I want to commend the Minister for Health and his team for an exceptional job thus far, Mr. Speaker. And this is a man who could have been in his private practice, but he's there saving humanity. And I also want to express my commendation to the fire officers, the fire chief, the deputy, the police officers, and we, the early morning, when you hear our dogs back, the sanitary workers are there picking up the garbage. All of us have an important role to play in this crisis, but we must be serious about fighting COVID-19. And if you're told to stay at home and dodo on your bed, Mr. Speaker. This is important. No government wants to curtail the civil liberties of people, but when it is concerning about the public good and public health, all of us must therefore conform to the conditions set out in the curfew order. And Mr. Speaker, I therefore commend this very important resolution before the Honorable House for its approval.
I'd like the Attorney General to guide us on, I think we have some amendment to the resolution.
Mr. Speaker, I'm not in terms of the hard copy. The amendment is in the second whereas, where the second paragraph starts and whereas the first one. Where it refers to chapter 1502, that should be 1503, but I believe the minister amended when he spoke. I think he actually said 1503. Okay. But for the record, the reference in the second recital there, it should be 1503 as opposed to 1502 as it appears.
Okay, it has been moved that the resolution be amended where we change 1502 to 1503. Any second?
Mr. Speaker, just since we are formalizing the amendment, I don't think the minister would mind me saying this because I did indicate to him. In the resolution it says, and I don't actually have the copy, but it says the Parliament, be it resolved that Parliament.
Yeah, be it resolved that Parliament.
Well, since I'm standing to seek to make an amendment by way of motion, I would ask that it be amended to say, instead of Parliament, to say this Honourable House.
Okay.
That's a normal format that would apply. Somehow Parliament found its way in there, but that's just a normal format.
No. Okay, all right. So debate, this concludes the debate. I will now put the question, be it resolved that this Honourable House approve the continuation of the proclamation, that is the statutory instrument number 14 of 2020, issued by the President on the first day of April 2020, to remain in force for the period of 3 months, and for emergency powers curfew order 2020, that is SRO 15 of 2020, to continue in force for a further period of 21 days after the 20th day of April 2020 to reduce the spread of the COVID-19. Those in favor? Aye. Those against? The ayes have it. The motion has been approved.
Mr. Speaker, I move the second reading of the bill shortly entitled Emergency Powers Amendment Act 2020. Mr. Speaker, on the 11th day of March 2020, the World Health Organization declared the infection commonly known as COVID-19 a pandemic. It means, therefore, Mr. Speaker, that every country in the world can be affected. Mr. Speaker, based on emerging reports globally, over 200 countries are affected thus far, with over 1.3 million persons infected worldwide. The global death toll is about 65,000 persons, with numbers steadily climbing. Mr. Speaker, on the 22nd day of March 2020, Dominica recorded its first case of the virus, and to date, there are 15 cases of infected persons recorded in the Commonwealth of Dominica. Mr. Speaker, while much is still unknown about this new virus, one thing that is emerging and is clear is that restricting interaction, social distancing, and curbing movement of persons can help stop the spread of this deadly virus. Mr. Speaker, Section 17 of the Constitution in Schedule 1 of the Commonwealth of Dominica Constitution Orders 1978 provides that the President may declare a period of public emergency if he is satisfied that a public emergency has arisen and as a result of the imminence of a state of war within Dominica and a foreign state, or as a result of any earthquake, hurricane, flood, fire, outbreak of pestilence, outbreak of infectious disease, or any other calamity, Mr. Speaker. Mr. Speaker, this threat of COVID-19 falls squarely onto what is contemplated by this section of the Constitution. Mr. Speaker, this Act seeks to amend the Emergency Powers Act, Chapter 1502, and to better provide for greater efficiency and effectiveness in protecting the interests of the state, its citizens, and residents in the circumstances of public emergency. Mr. Speaker, this amendment consists of 5 sections. Section 3 amends Section 2 of the Act by deleting subsection 1 and substituting the text as appears. By this section, the President is empowered to, by proclamation, declare that a state of emergency exists in Dominica or in any part of Dominica if he is satisfied of any of the following. 1, imminence of a state of war within Dominica and any other country, and any action taken by a body of persons that may endanger public safety. The impending occurrence of any natural disaster, outbreak of pestilence or infectious disease, or anything of that nature. Section 4 of this amendment seeks to amend Section 3 of the Act. Section 3 of the Act is amended by A, renumbering the section as a subsection 1. B, by inserting the sections 2 and 3, Mr. Speaker, by inserting subsections 2 and 3. These sections indicate that regulations and orders made under this section may provide for restrictions of the movement of persons in Dominica through curfews and the regulations of gathering, and for the requisition of supply and distribution of essential items, private lands and buildings, for the demolition of any building or structure deemed dangerous for the disposal of the dead, and for dispensing with the provisions of the Act mentioned therein. Mr. Speaker, Section 5 of the Act is amended by deleting the word 5 and substituting 10. Mr. Speaker, I therefore commend this Emergency Powers Amendment Bill 2020 to this Honorable House for consideration.
The bill is before the House for debate.
Mr. Speaker, thank you. The matter before us, the amendment to the Emergency Powers Disaster Act, is very interesting because earlier today, members on the other side stood in this honorable house and insisted that the proclamation by the President and the curfew order made under the Disaster Powers Emergency Act, the Emergency Powers Disaster Act, Chapter 1503, was correct, even though we pointed out that the correct application of law required that declaration of curfew or curfew order to be made under Section 1502, it being the only one of the two emergency powers legislation that actually grants the power of curfew. Now, I heard the Attorney General earlier, and he was talking about the power or the authority to declare a public emergency. That authority is not in law. It's in law, but it is first and foremost in the supreme law, the Constitution. It's in the Constitution. So if the President is appropriating unto himself a power that the Constitution grants, there is no reason to look for it in law. It is already in the Constitution. But the Constitution does not make any specific provisions for curfew, which is in the Emergency Powers Disaster Act. Now we have before us, hot on the heels of the earlier discussion, an amendment to the Emergency Powers Act that is essentially indulging in redundancies. You're pulling from the Emergency Powers Disaster Act a whole series of provisions for orders by regulation that are not now in the Emergency Powers Act, but which we don't need. You already have them in the Emergency Powers Disaster Act. You're taking them from the Emergency Powers Disaster Act and you're putting them in the Emergency Powers Act. This is, rather than come with this, Mr. Speaker, I thought the time of the Parliament would be better spent examining the mobilization of resources to fight this contagion. We heard about it this morning. Everybody is united on the need to find resources to fight this contagion. At the level of healthcare first, we were with the prevention strategies and the border protection, etc. The COVID-19 came. We are hopefully into hard containment right now, which is about identification and isolation and treatment, etc. But at the same time, with over 1.3 million people affected in over 200 countries around the world, and we're watching to see how quickly our numbers are rising here in Dominica and how we can take care of things. And with economic fallout already beginning to impact us, we're hearing from the government side of this House that now is not the time for a stimulus package. Now is not the time to look after people who are in difficulty as a result of the mitigation measures we are adopting. The need for them to stay home, the necessity for them to be under curfew restrictions, etc. The whole question of people losing their jobs in the process or having their business income curtailed by actions that they have to take to facilitate the social distancing protocols under our mitigation strategy. For example, the bus drivers who are being asked to put one passenger per row. That's fine, social distancing. But the bus normally holds 16 people. Are you going to ask them to increase the price per passenger on the bus? Or is the government going to use its resources to compensate them so that they are not out of pocket for rendering this important service on our social distancing agenda? That's what we're talking about. We have the vendors at the market selling fresh food, selling healthy food. We made recommendations a couple of weeks ago as to how the fresh food market could be reorganized so that it caters for the social distancing requirements at this time. And what do we see today? Police with long guns, hustling vendors seeking to sell fresh fruits, vegetables, fruits, that can help to build our immune system, the best defense we have against this COVID virus. We have to do something about these things. So when we point this out, this is not negative. This does not mean we're not with you. This means we want you to do better for Dominica, because all of us will benefit from that. That's what we're talking about. So I heard some, quite surprisingly, Mr. Speaker, some quarreling this morning. People came here quarreling. They talk about, oh, who want to some fancy and bring stimulus package, and no, it's not. What's that about? This stimulus oh, you won't listen to the Prime Minister? Oh, you won't? You won't listen to the Prime Minister? I think that the Prime Minister needs to talk to you privately about paying attention to what he says while you're in this house. Huh? Because I think it is disrespectful for you to sit down in the Parliament pretending that you're participating, and the Prime Minister is making comments that you're not taking note of. It's very disrespectful. But that's for you all. And Mr. Speaker, what we are saying is, you cannot come to the people and tell them at this point in time, knowing where we are, knowing how this virus is impacting the rest of the world and is likely to impact us here. Mr. Speaker, I am happy with the way you allow the debate to flow, but I'm getting a little bit sick and tired of these nonsensical interruptions from the other side, which make no sense. If you have something of value to add, if you have something to say, because what is said here misrepresented anything that you said in your presentation, you have the right under the standing orders to get up right after I have spoken and offer clarification. The rules allow you to do that. But, Mr. Speaker, I'd really appreciate if the member desists from disturbing my presentation. Good. Now, Mr. Speaker, we have to come to the stage where we understand that there is a necessity for emergency public support that is going to maintain the livelihoods of people, maintain their employment income, delay mortgage payments, delay rent payments, provide groceries and medical and other necessary expenses. And we cited the example of reduced numbers on the buses. That is going to affect the income of bus drivers, taxi operators, and so on. The question is, where is the compensation to them going to come from? Because they're going to suffer loss. The people who are losing their jobs because the operations where they work are no longer functioning or are at reduced hours. What is there to subsist their income? So we have to be thinking, Mr. Speaker, in our role as parliamentarians, we have to be thinking the best interests of all the people. And that is why we need to come to this Parliament, and we can do that tomorrow, to discuss a package of relief, recovery, and economic stimulation. We can walk and we can chew gum at the same time. We can put this legislation, we can pass this piece of legislation before us, but to the extent that it is about our battle with COVID-19, there are other things, Mr. Speaker, in my view, which come ahead of that in priority, especially in terms of what we have discussed so far today. Our country needs the necessary financing that is targeted to critical areas of need. Note well, our health is our wealth. Nobody disagrees with that. In 2018-2019, in this Parliament, our healthcare budget was $22.3 million. Our public sector investment provision for health in 2018-2019 was $22.3 million. How much did we spend? We spent $11.5 million, 51.5%, 51.5% for the approved public sector investment spending in healthcare in the same year, that the approved $1 billion budget was overspent by $322 million. Our health is our wealth. The overall investment in healthcare for 2018-2019 was a miserable 3.6% of the unapproved spending of $322 million of our budget. And I'm saying these things because this is what we do here in the Parliament. This is the record of the Parliament. So when we come and we take the attitude that, oh, the government says so, so is so. If you ask a question, then you don't agree with the government, you're not united, you want to go to the altar to get married, when they ask you to say I do, you say I do but. Yes. We have some observations and we have some reservations about some of the things that the government is doing. And when the government says that it cannot deal with economic stimulation right now, the Prime Minister said, now is not the time for that. Well, okay, good, now is not the time for that. That's the Prime Minister's position. Our position in the parliamentary opposition is that now is the time for it. Good. So we want to see a healthcare system that is strong, it's well prepared, it's adequately resourced for the COVID-19 battle in terms of additional hospital capacity, intensive care capacity, availability of necessary medications, supplies and equipment, personal protective equipment, ventilators, testing equipment. And I'm happy to hear the strides we have made so far in improving our numbers in that regard, but we need to keep moving. It's all well and good to come to this Parliament and beat our chest and say, we have done all that is possible to be done. Nothing else could be done. We are perfect. In the meantime, when we meet privately among ourselves, we're asking ourselves what's going on, and people are being sent on long leave because they come from certain areas of Dominica and so on. And we are bigging up others, right? We need to spend money on emergency insurance for all frontline workers, including but not limited to those who are in healthcare, those in immigration, those in police, in customs, in the environment, in ports, to cater for payment of medicals. We want to see an accelerated completion of the Marigot Hospital that should be equipped now with an acute isolation wing for COVID-19 suspected patients coming in at the island's main airport. Now let me talk about this. Every single member of this Parliament, bar none, was born into this world in Dominica when there was a functioning hospital at Marigot. Every single one of you, every single one of us. Because the hospital started there in the 1920s. And we come now in 2020. It is 6 years since we have had not only no hospital in Marigot for the Northeast District and the main airport in Dominica, but we have had no health clinic for the past how many years? People have been going across to Wesley. Now, when we look at how our healthcare spending has been taking place, as I referenced just now from the last budget, The question is asked, are we serious? So this is an item that needs to be moved up on the agenda. Yes, we have started construction, but we need to expedite the construction because this COVID-19 is going to be with us for a little while. Some of the experts say for the next year, some say for the next 18 months. We hope it is not as long as that. We need to see. We want adequate epidemiological surveillance systems that are able to rapidly detect community-level outbreaks of COVID-19 and produce data on differential impacts and the rates of infections so that we can plan, look ahead, hopefully get ourselves ahead of the curve. We need reliable protocols for monitoring and responding to the burden on the health system and equitable access to all for prevention and healthcare resources, as well as specialized individual services when required. I notice a trend again, the trend towards politicization of resources, and the trend that when we come into this parliament, everybody puts up their hand and says, we're not playing politics, we're not playing politics. We're not playing politics. But everybody on the other side is playing politics. So we need money for these things. And we need money for emergency relief. We need money for recovery, protection of consumers, stimulation of the economy, and we need that money now. In terms of employment, income, and business continuity support, it is more important for us to be focused on this now, at this time, than redundant amendments to legislation which we have already catered for, as this morning's motion, which has passed the floor, indicates. Paid sick leave to those who have contracted COVID-19. Wage replacement or wage layoff grants, layoff protection grants for all employees displaced. Monthly income support grants for all self-employed persons who must suspend operations due to COVID-19. Direct supplementary income for hucksters unable to ply their trade, workers in retail, tourism, and other sectors, cruise bus, taxi operators, and public transportation providers affected by COVID-19, social distancing, and other prevention and mitigation strategies. We need deferral of payment for rent and utilities for 3 months in the first instance, financial support for supply chain stabilization in small and medium enterprises.
Remember, I give a lot of leeway.
Mr. Speaker.
Earlier.
On a point of order.
Hold on.
Mr. Speaker.
But the direction you're going to move in, I have to ask in regards to relevance. You know, but again.
Mr. Speaker.
Mr. Speaker, it is interesting.
Hold on, Honorable Lennox Linton, have a seat a while. Let me hear what he has to say.
Mr. Speaker, this measure before this House is a proposed amendment to the emergency powers. So I am not sure why the member is going off on a tangent. I am baffled. Let's stick to the matter before this Honorable House.
So members, just stay focused on the relevant matter, which is really the amendment to the bill. Because you were going to give a long...
Mr. Speaker, with due respect, sir.
Yes.
With due respect, sir. The House listened this morning to an extensive, elaborate presentation from the Prime Minister, that has absolutely nothing to do with the substance. Responding to me? About what? All I said this morning was I support the measures. I'd like to see it dealt with under Section 50, under Chapter 1502, not Chapter 1503. That's all I said. I didn't mention anything about stimulus package. You brought it into the discussion this morning. Nobody asked about relevance. The Attorney General looked ahead and predicted, what do you call it, Mr. Speaker? Forecasted or anticipated. The Attorney General anticipated this discussion earlier on.
On a point of order, Mr. Speaker. The Attorney General did not, as so far as law is concerned anyway, anticipate. The Attorney General made reference to the fact that there will be a subsequent debate on a bill. That's a different thing to engaging into elaboration on the content of the bill. Whilst I'm on my feet, Mr. Speaker, the point is, and I don't understand why the member would even make a debate about it. He did it. He got away with it to a certain point. He knows perfectly well that what he's been saying for the last 5 minutes has nothing to do with the amendment to the Emergency Powers Act. And I think he should just move on.
Mr. Speaker, I just want to know whether or not this Honourable House is saying, the members on the other side of this Honourable House is saying, they do not want to hear anything about relief, recovery, and economic stimulation at this point in time in Dominica, and the Honourable Member from Marigot, Leader of the Opposition, will be guided accordingly. Let me hear what is the resolution of the House in this regard. Is it that you do not want to hear anything about economic stimulation, relief, and recovery for the people of Dominica who are affected by this pandemic?
Remember, you're on your feet, so just proceed.
Yes, yeah, because I'm thinking.
And as we said earlier, just be guided.
Yeah, but I'm thinking that if we are, and in introducing the measure, the bill before the House, the Honourable Minister specifically referenced the welfare of the people of Dominica and the impact that this piece of legislation will have on the welfare of the people of Dominica. And I'm saying that there are other matters that the Parliament has to deal with side by side with this, even more importantly than this, for the welfare and the well-being of the people of Dominica. Things like suspension of consumer and small business credit payments, support for vulnerable groups like informal workers, homeless and those at risk of homelessness. These are the people who are going to come under the restrictions and the regulations of this amended bill that we're talking about. Single-parent households, domestic workers, people living with disabilities. We need to look after the interests of our country insofar as food security is concerned. It cannot be that while this is impacting us, and we are in a situation where upwards of 70% of what we consume comes from the outside world, with the sort of disruptions taking place in this global supply chain for food right now, you're telling us we must wait to commence or to do anything about our food security initiative that will help us through this COVID-19 period and beyond. Reposition us now for a re-emerging economy that will have a greater impact in the islands around us in terms of our nature island products, the things that we can give the global community and give ourselves to protect this immune system, which is our principal defense against COVID-19 and the telecommunications enablement. But Mr. Speaker, to close, the elephant in the room, because this legislation, the amendment that's before us, is proposing legislative underpinning for certain things that need to be done, things that will cost money. So we go back to the question raised earlier about the mobilization of resources. We have presented, and I sent to leading state actors, as leader of the parliamentary opposition last week, Mr. Speaker, a document on financing the response of the Dominica state to COVID-19. And we proposed in that document a series of relief, recovery, and economic stimulus measures, which carries an estimated cost of $300 million. And we have stated in that document that the financing will come from funds in the Citizenship by Investment Program. We're talking about mobilization of resources now. Specifically, we have said in that document, and I'm quoting here now, all funds collected from the sale of Dominican citizenship through the so-called housing component of the CBI.
Remember, you're moving on a slippery slope. Again, I cautioned on relevance. On relevance. I give a lot of leeway earlier.
Powers.
Because I think, remember, just let me make a point there, just a point. This matter is very serious. We meet on an emergency situation. I allowed all members to get the opportunity to talk. But
I cannot allow you to go on a serious tangent away from the substantive matter. I'll allow you again to wind up, but be careful on how you move in regards to financial resources. We are not in a budget debate. We are on a bill. I mean, I know you know better, so I'll allow you to wind up. Yes. Hold on, the Attorney General want to advise us on something. Yes.
Standing Order 44.1. Subject to the provisions of Standing Order 12 and 13, debate upon any motion, bill, or amendment shall be relevant to such motion, bill, or amendment, and a member shall confine his observations to the subject under discussion. There are other provisions which deal about sub judice and so on, but I think that sub 1 is as clear as can be.
Your mic is off. Your mic is off.
I'm actually smiling at this selective application of the standing orders because just a while ago, the Honorable Minister for Health rose to offer clarifications. What is the standing order provision for that? At Standing Order 41.5, Rules of Debate, it says a member who has spoken on a question may, with the Speaker's permission, again be heard to offer explanation of some material part of his speech which he claims he has been misrepresented, but he shall not introduce new matter. He must offer the explanation immediately at the conclusion of the speech which calls for it.
No, you see, remember, have a seat.
That's the standing order.
Yeah, just have your seat, you'll resume. Listen. The Senator Sanford, was delivering. She actually asked that the Minister of Health respond to certain questions. I think that in my own deliberation and judgment, that this matter dealing with COVID-19 is a matter of national security and a risk to everyone in Dominica. And I think that the minister has a legal and moral obligation to explain and clarify to the general public and to this honorable house. So I gave him 2 minutes to respond to the question asked by the senator who was on her feet. That's why.
Mr. Speaker, that's all well and good, you know, and I commend you for that. But the point is, the standing order is the standing order. He must offer the explanation immediately at the conclusion of the speech, which calls for it. After the conclusion of the speech, which called for the explanation, you had a presentation in the House from Ian Douglas, the member for Portsmouth. Huh? All right. So what we're looking at, what this establishes, is the selective application of the standing orders, and the attempt now to use the standing orders because Leonard Clinton, the leader of the opposition, is on his feet, making some observations about relevance and priority, and finding the mobilization, the money, to deal with our COVID-specific issues in 2020, right? And we are saying that for all the work in this emergency powers, the Emergency Powers Amendment Bill, because look, you have here restriction on movement of persons in between specific parts of Dominica, requisitioning and regulating supply and distribution of food, clothing, water, fuel, light, other necessities of life, and fixing maximum wholesale and retail price in respect thereof. In terms of provision of the necessities of life, we need money. We need money. We need money. The Emergency Powers Amendment is calling to us for money, but this government has not seen it fit yet to put a budget together to take care of these necessities of life, to take care of the health care and the necessities of life. And that's why we are proposing, Mr. Speaker, that all funds collected from the sale of Dominican citizenship through the so-called housing component of the CBI in the last 2 financial years, 2018-2019 and 2019-2020, estimated to be more than $1.2 billion, less amounts used for the construction of public housing and other state projects.
Member. No, I put off your mic. Relax, just have your seat. I cautioned, I knew that's the direction you were going. I'm suggesting to you in a respectful way that that is a wrong approach. You are the chairman of the Public Accounts Committee. If you have a matter to deal with in regards to money spent that have been audited, then you can convene a Public Accounts Committee meeting and do whatever you need to do under the law. I'll ask you now to wind up because your time is almost up and focus on the substantive matter, which is the bill, the Emergency Powers Amendment Act.
It remains that the provision of food, clothing, water, fuel, light, and other necessities of life require money. And we need to identify a source of the money. What I was doing, Mr. Speaker, is inviting the Cabinet of Ministers to institute legislation in this Honorable House. Just like we're coming with legislation today to deal with COVID, these recommendations that we talk about are in respect to Dominica in and post-COVID-19. And so I'm inviting, as leader of the parliamentary opposition, the Cabinet of Ministers to institute legislation to reassign the CBI housing revenues in accordance with the Constitution that we all stand for, the rule of law, the Finance Administration Act, and allocate an initial amount of $300 million for COVID-19 relief, recovery, and economic stimulation measures. Mr. Speaker, given the social disruption and economic devastation facing the nation from the expected ravages of COVID-19, there is no better time for the people's money to be placed in the people's treasury to take care of the people's urgent business. I thank you, Mr. Speaker.
Mr. Speaker, I rise to give a short intervention on the simple but important amendment before the House. And this amendment to the legislation is to give the government more tools to be able to confront the spread of this virus, thereby containing it to manageable levels in our country. But while the leader of the opposition, Mr. Speaker, is out looking for money and searching for money, I would also like him to put on the table the $800,000 US, which he received for the sale of 2 diplomatic passports to 2 criminals from the Philippines as part of this fundraising and fund identification exercise. Because the money came on for humanitarian reasons. And I'm wondering...
Objection. Mr. Speaker, that is a flat-out lie. At no point in my life have I ever received any money from anybody for economic citizenship in Dominica or any other country in the world. So with your permission, Mr. Speaker, unless this gentleman can show documentation that I, Lennox Linton, received any such money, he should withdraw the statement.
So you see, and that's what I was trying to guard this honorable house from, where we have debate on the bill. We start talking about monies and side talk. So as the, hold on. Honorable Prime Minister, you can be back on your feet. And as he indicated that about evidence and all that.
Mr. Speaker,
yes.
Mr. Speaker, what information that is in the public domain, I don't need to bring to the Parliament. It is known to the public. Exactly. It is out there in the public domain, signatures, signed, and so forth. I don't need to do those, Mr. Speaker.
So proceed.
We came here, Mr. Speaker, to deal with something very important. the truth be told, I would have expected us to be out there by 11:30 this morning and to go about to deal with other urgent matters of state. That doesn't mean to say that the parliament is unimportant. But we have to treat with matters at the appointed time. And we have a situation where the health experts globally and nationally are saying to us that the issue of social distancing is important to fight the spread of the virus. And this is why we're here, to seek to put in measures legislatively to allow for this to happen. But when people come here and pretend to be caring about the citizens of Dominica, they're not interesting people, Mr. Speaker. There's no seriousness, there is no conviction, there is no interest in putting forward anything. All Mr. Linton wants to do is to continue to spew his negativism and his destructive approach towards this thing. And while he's doing this, there are people on the front line. He went to the mountain top with an unused cutlass with some cane and said he's in Zion and run away from the issue at hand. We have never said that the issue of looking after the economic and financial fallout ought not to be considered by the government. As a matter of fact, Mr. Speaker, in response to the other side, I indicated the number of actions that we have taken and intend to take in putting this together. We, as we say, we had a Monetary Council meeting. A decision was taken by the Monetary Council to reduce the discount rate from 6.5% to 2%, and to also reduce the commitment of the EC against the US dollar to allow for more money to be made available to the commercial banks. More money available to commercial banks at a lower interest rate is good news to people who do conduct business with the financial institutions. It means, therefore, the bank will have greater liquidity to lend to the private sector and other entities at lower interest rates. That is essentially what was done in the United States of America. And so, Mr. Speaker, we have also had discussions, and I have also written to the World Bank, one, to take advantage of the additional funds that they have available currently at the World Bank. We have also had meetings with the IMF to engage them with opportunities for additional funding which they have, so we can access those funds to put in as part of the pot. And we also will be having discussions at the sub-regional level with the Caribbean Development Bank. We have received requests and recommendations from various private sector entities. These have been analyzed by the government's advisors within the public service. We intend to have consultation with private sector entities this week so that we can have ideas contained. We're not saying that. But what we say, Mr. Speaker, is this, that our preoccupation at this time is to contain this virus. And if we fail on this, Mr. Speaker, all of the discussions we will have, all of the things we'll have on paper of stimulus package, etc., will be of no value to us. That's what we say. As a matter of fact, Madam Speaker, economists are advising governments that their preoccupation should be on saving lives. Because if you do not save lives, what would be the benefit of this stimulus package to dead people? So somebody who does not have a job today because of the contraction of business, if that person does not stay alive, it's of no value to him tomorrow, even if a job is promised to him. But as far as focusing the state's attention, the government's attention, the country's attention, it has to be on the fight of this thing. If we do not hold this thing and wrestle it to the ground and allow it to escape from our hands, we'll have a challenge. And we have seen experiences otherwise. So we're not saying that this is unimportant. What we're saying is that if a patient comes to you now, your first order of business is to keep that patient alive. And then when you resuscitate him, when you cause him to go home, then you can discuss with him his situation. And as we have also indicated, that this has to be a national effort. In all of my addresses to the nation thus far on this matter, we have called on all our citizens in Dominica to reach out to one another. If we know of people, do not come and make generalized statements in here. If you know of a particular case, a particular family who needs help, then say so. And question is, what outreach have you provided to that person? But this is not a time for us to come to make political points and to prey on the emotion and fear and anxiety of the people. That's not what it is. That should not be. So if you come in with a sincerity of heart, then let us engage. But when you descend into a election time rhetoric and tone and attitude and body language, where's the engagement? Where's the national unity that you are proposing? The government has never said that it can fight the COVID virus on its own. No, this is why we have engaged everybody. This is why we have consulted. And when the leader of the opposition talks about consultation, we invited him to the last consultation and he said nothing. Said nothing. Instead, they're looking for all sorts of negatives to promote. All sorts of negatives to promote. And wasting time that we should be out there marshalling the troops as a united front towards the containment. Because we have nurses and doctors out there in the mountains and the valleys fetching people through the contact tracing to ensure that they can capture them before time. Before time. And I thought I was hoping we'd come here, read this motion, this resolution, say the ayes have it, and we stand in an applause to all who are on the front line, and to send a message to them that the Parliament of Dominica is with them in thoughts and in prayers. And I have been around for some 20 years, Mr. Speaker. And I am leaving this Parliament saddened by the behavior of the Parliament. Saddened by the behavior of the Parliament. Because I understand and appreciate, Mr. Speaker, what these frontline people are putting themselves at, the risk that they put themselves in. For us to come here and engage ourselves as if, well, it is a few days before December, one of the elections, December 6 or December 6, 2019. I am not, as one Prime Minister said in a public address, I am not looking for votes, Mr. Speaker. Certainly not at this time. At the appropriate time, I will look for votes. But for me, as the leader of this country, I am preoccupied with ensuring that we can contain the spread of this disease and to keep our citizens alive. And this is why I have given the Ministry of Health a blank check to do whatever is required to fight this. Whatever is required. And whatever action the health professionals think that they have to take, they can take it without even consulting me, inform me later. This is what I have given to the health team. And we come here and we spew in this division, this unnecessary rhetoric, instead of putting forward sincere proposals. Sincere proposals. We have young doctors in their 30s. People like Dr. Jean-Jacques on the front line, a young doctor. People like Dr. Savrin on the front line. Dr. Breedy, all of these people out there in the front line, Nurse Matthew, Nurse Nicholas, all of these people out down there in the front line, left their families, Mr. Speaker. The domestic people, you know, that's what we should have been there. We should have issued, Mr. Speaker, a resolution expressing our gratitude to all of these people. But, as is always the case, the government is left alone to carry the burden of looking after the whole of the country. Because we do not have in place a responsible leader of the opposition who can rise to the occasion when it demands of him to so do. But that is life, and we shall just have to ride with it. Ride with it. But we will not give up. We will continue to fight. This is a fight. We do not know a war. We do not know how long it's going to last. And as the expert on infectious diseases said, Dr. Anthony Fauci, that the disease is controlling the timeline. And we can only hope and pray that it will be short-lived. But for us to assist in it being short-lived, these measures are important. And that's why we're here. So yes, there will be an opportunity for us to discuss other stimulus and economic and financial packages, because the work is ongoing behind the scenes with regard to that. But if we take our eyes off the moving target, we have a problem. It was in Dalis, it went out to the west coast in Canefield, it went up to Concord, it went up to the Carnival territory. It's moving. And as the experts say, you can show no symptoms but carrying it and spreading it. And that is the fear, and that is the danger. That is why it is so wicked, this virus, Mr. Speaker. So it's not only having the cough and having the fever and having the diarrhea, Mr. Speaker. You can look perfectly fine. This is why we're saying at this time, the preoccupation should be on saving lives and not economics. As important as economics will always be, and as important as money will be, now is the time for us to focus our resources on saving lives in our country and preventing the spread of this virus. Because if our able-bodied population were to go under because of this virus, what would happen to this country? What would happen to this country? That's all we're saying. That's all we're saying. And I am extraordinarily disappointed in the lack of maturity in this parliament. You can, if you support something, support it. There's nothing wrong in saying how it can be perfected, how it can be improved, because it's not a perfect system we have. It is not foolproof. But you're not doing so with any genuine concern or care. And this has never been about me, and I will never make it about me. I am just in this position making my own simple contribution. I've always considered myself to be the least of the apostles. But when I have, for example, my Minister of Health, who put forth his professional qualification and goes himself along with another doctor and to do a swabbing of a suspected case as part of our efforts. That is what we need. People going beyond the call of duty. But what duty are you going on in the other side? If you're not showing up for duty, there's no way you can go beyond the call of duty. And your country needs you. So when we come here and talk about constituents, do you have a list of constituents who need help from the Marigot constituency? Where's your list? So I am not here to come and talk about state of diplomatic passports and so on. This was in passing response. Because I do not have the luxury of people like the leader of opposition to spend time dealing with issues. Because ultimately, the buck stops with me. And I don't run away from responsibilities. And I take full responsibility as the leader of this country for anything that goes wrong. That's me. But can we in this country, in this instance, be sincere with our comments and our contributions? If you come here and concern about the school children, this is not a place for us to come and belittle what the educators are doing, the teachers are doing. These are not come to see whether you can give your former colleague who is not the Minister of Education a black eye. These are not about scoring points. This is about a fight of our life, which is worse than a hurricane, because we could have hidden in our toilets during a hurricane. We had concrete roofs, some of us, or hurricane. But with that thing, you can't see it. You can't hear it. And it could be anywhere. Anywhere, and many places at the same time. And that is the concern of health professionals and all of us who are sincere with our efforts towards fighting this thing. Mr. Speaker, let's go for lunch. Mr. Speaker, thank you very much. I move that the House be suspended until what time? 3:30? 3:30. 3:30? 3:30.
Second, Mr. Speaker.
It has been moved and seconded that the House be suspended at 3:30. Until 3:30. Okay, until 3:30. Those in favor? Those against? The ayes have it. The House stands suspended up to 3 p.m. 3:30 or 3 p.m.? 3 p.m. 3:30, okay, 3:30.